Hi, everybody. Hi, happy Sunday. Look at where we are. And look at how many wonderful people are here to see me tonight and talking about Foodie Beauty's boils. So thank you for joining me on this. It's been a long time since I've spoken about Foodie Beauty. And obviously, I'm still a registered nurse here in the United States. And if you have not seen me in some time, since I have not made a lot of commentary about Chantel recently, though I feel like it's time to maybe circle back around and check in on our friend since she's laying horizontal. But I am trained to be a psychiatric mental health nurse practitioner. So welcome, welcome, welcome. So let me just make sure I say hi to everybody. Angel Glasses here, acting as moderator. Thank you so much. We also have Catherine here, our antipod friend. She's at lunch and we're getting ready for bed. Marina's here. Hi, come on in. We've got Tater Fluff is here. I said hey to Marina. I want to make sure I got everyone coming in. Sammy in Brooklyn is here. Hey, come on in. You're looking forward to this? You've having a boil issue your whole life? Oh, didn't matter your weight. I believe the bedbound arc has started. This arc has been unfortunately happening for some time. Though she doesn't really look like a seal. She looks more like a worm. Lying here. It's more got a gusano look. But I don't want to scare you with this topic then, especially because we're going to be kind of covering it with Chantel, and in light of the fact that she obviously is a type 2 diabetic. And hey, Sharon, come on in. Come on in. Kath, is she starfishing for you? Oh, gosh. That's a terrible thought. So anyway, for those of you who may not know, I actually have an extensive history working in hospice care, and part of certain types of long-term care for people who are coming out of very bad illnesses. And so when I was hearing that Chantel, and we don't know whether or not she does or does not have this boil where she says she does. And I don't think any of us want to look. But obviously, somebody who is type 2 diabetic and somebody who's particularly uncontrolled and unmanaged and not receiving really good physician care, because we know she's living in a foreign country, and despite her stating that she's got all this access to all these different doctors, we understand that there are limitations to the amount of care that she would be able to receive by being on a tourist visa. And despite her wanting to say all the time she's married, this, that, and the other, we know she has to leave and go back and forth. So it's a charade that none of us, if Chantel wants to live in the delusional world of that in order to create the drama, or to kind of double down on her storyline, then go ahead, girl. Be our guest. You go ahead. You do it, girl. I'm here for you, Foodie. But we know it's a charade, and so there's always this back and forth. Anyway, so recently, and we won't go through all this video because supposedly she's posted out an update, and I know that other people have obviously covered this, but I did work in hospice care. I did hospice case management, and I also did hospice inpatient, managing patients with very bad terminal agitation and a lot of pain, and it was a number of different illnesses. And one of the ones that I became familiar with, and I found out it often would start in men because of hairs getting trapped in their backside areas and sitting, and having diabetes type 2 particularly was kind of one of the illnesses that these folks would have in common with one another, because they do not heal well. And we're going to take a look at a little bit from a recent paper published in the National Institutes of Health about a comprehensive overview of the different types of skin disorders, skin complications with diabetics and some of their prevention. Because it could be type 1 or type 2. That's not really important. The really important part is that these boils that she does speak of are quite common. And they do talk about the folliculitis too. Now, what can happen is that, believe it or not, if you do not take care of these and they do become ingrown hairs, or boils or lesions that are not healing and you are unaware of it, it actually can develop into a number of really bad disorders, of which both are deadly. Both are infectious, and both are deadly. One is obviously sepsis, which is a bloodstream infection, and we'll go over some of the things about sepsis. It's a very common yes, carbuncles with fever. Oh, I'm sorry to hear that. Oh, I'm sorry to hear that, Sammy. You love the real information. Oh, yeah, and Tim's been on a roll today. I guess I'm part of the hater club. He did the. We're not talking Tim today, but he was on a roll. I'm glad. Do I have this as just people who are like people who, no, because Angela Glass is here, but she's a moderator. I'm wondering if I made the chat just for people who were only, hold on, let me check my chat over here, because I thought I made it subscribers, and I feel like I only have it for members. Let me check something real fast over here in my YouTube studio. Sorry, guys. I am so professional. I haven't done Foodie for a while, so I was just like noticing. I was like, can other people make comments? I thought they could. Let me double check. Let me go in and just double check something here on the customization. Yeah, it says members. Okay. Oh, subscribers. Let me change it to subscribers. Okay, that's what's going on. Sorry, guys. Okay, anybody who's subscribed to the channel can do that. I knew something was up. Sorry, guys. Oh, my goodness. Okay, sorry about that. Oh, I knew something was weird. Okay, I fixed it. So anybody who's just subscribed to the channel can chat. I was like, hey, Candace. I was like, I know people are watching. I only seem like members of the community, and I just realized I hit the wrong button, guys. I apologize. Hey, at least I know how to fix stuff. I almost felt like Chantel there. Oh, yay. Hey, guys, come on in. My goodness. Make sure you hit the likes when you come in so other people know that I'm talking about Foodie's boils and carbuncles this evening. Yeah, thank you, guys. I'm so sorry about that. I made something, a mistake on the setup. Anyway, we just got started, and I was explaining about Chantel's life-threatening skin lesions, then, and which way they could go. One of the ways is obviously sepsis. If you have often these types of boils or lesions, especially near a personal area, that's going to be really close to some nasty stuff on urination and things. And Chantel not particularly clean. And people are wondering, like, how was she not complaining about it and she was out doing all this stuff? Well, potentially what I'm thinking is her being out and being more active and busy probably caused more friction rub for her, because she was actually out walking about and potentially had exacerbated a skin lesion. And so we'll take a look at some of the ideas of those. But yes, sepsis is very deadly. And I'm sure some of you have heard of sepsis. But let me show this little, let me get over to that, because we're at the hospital. We constantly have to screen people for sepsis because sepsis is so bad. And so I'm going to show this tab very quickly from the World Health Organization. Let me make sure I'm a decent size. Okay. Oh God, this could be Chantel. Hey, Louise, come on in. Come on in. Make sure to hit the likes on the way in. Yeah, I do have membership still. And I forgot to add in all the extra emojis. Now we have more members. Okay. So this is from the World Health Organization. Oh my gosh. So sepsis. And if you have something like this type of skin infection as a diabetic, and you just land and it gets a staph, and it gets into your bloodstream, it is not unusual. And Eloise can probably attest to this, that a ingrown hair can easily turn somebody into becoming septic. And so Chantel just lying there and laughing. I'm glad she didn't have a fever, but it's not a great thing. So obviously this talks about a lot of, just the prevalence of the disorder of sepsis. And as I said, in the hospital, we have like alerts when patients are in the hospital that ask us specific questions in order to rule sepsis out or patients suddenly becoming septic. And it's a life-threatening condition. How many people die? It's one of the most frequent causes of death worldwide. Oh, Lord, Chantel. Sorry, guys. I'm on the, I've been outside gardening all day, and I'm on the Loratadine D to dry up from the pollen. It was 80 some degrees here in Virginia today. It was like summer. So I was out. Hey, Sandra, you won a membership last night. Congratulations. So yes, sepsis is something I don't know if anyone's spoken. I don't watch a few of the obviously Chantel channels. But obviously I'm so embroiled in my own messy legal battles with Sarasota Tim at the moment. If you haven't checked it out, if you're a member of the channel, you can see the counter notification that my attorneys have sent to Sarasota Tim. Anyway, so yes, 48.9 million cases, 11 million sepsis-related deaths worldwide, representing 20% of all global deaths. So this is pretty severe. And so sitting there laughing, and if this really is something that she truly has and is not just something that is for content, and if it is something reoccurring, then her potential and chances of becoming septic are more greatly increased. And it's very easy to get these bloodstream, especially from a boil and ingrown hair. And diabetes, she has a lot of things. So it's a life-threatening condition that happens when the body's immune system has an extreme response to an infection. So you easily get an infection in there, like a staph or something, causing organ dysfunction. And then obviously its body's reaction causes damage to its own tissue and organs, and it can lead to shock, multiple organ failure, and sometimes death, especially if not recognized early and treated promptly. And Chantel obviously is very negligent at trying to get any prompt treatment on anything. I'm sorry if I'm not keeping up with the chat. You guys chat away. Late but here. Hey. Glad to have medical professionals speaking rather than the numpty in Kuwait. Well, she's so expert. She's probably one of these people who just says that, she knows her body. So, when you know your body, you don't need to seek medical help. Well, I'm just glad you're here too, Eloise. Keep us going in the chat with the medical help too, because we got Eloise here. She knows a lot about this stuff, so she could easily become septic. Could affect anyone. Fever, fast heart rate, rapid breathing, confusion, body pain, and then you get multiple organ failure and death. Caused by bacterial infections, but maybe the result of other infections such as virus. So bacterial is very important because something like a boil, you scratch your skin, you get a staph in there because you're dirty, you're not bathing properly, and you could easily get staphylococcus in there. And the next thing you know, you've got a bloodstream infection of sepsis. It's not difficult, especially down in that groin area, all moist. That's just bacteria, yeast city waiting to happen. This can also happen in obviously in the healthcare environment too. So who's at risk? Older folks, pregnant, neonates, hospitalized, intensive care, weakened immune system. And Chantel, I'm sure, with her diabetes is uncontrolled. Thank you, Bees and Junebug. And then obviously chronic medical conditions, of which Chantel has numerous, including type 2 diabetes. She has the liver disease, and then there's a new name for it. It's not non-fatty. They call it something else now. Probably heart disease. She probably got, she's probably got neuropathies. I mean, from the diabetes, she's probably got like raging metabolic syndrome. I mean, I mean, she has this all the time, this pale skin and lethargy. I mean, so here we go, how we get prevention here. And this is why it's so important before we get to Dirty Chantel. Hey! Because Chantel basically needs to be treating the infection early. So she really was having this nasty, pus-laden, and supposedly she had a health update. And I want to say she said it popped. I don't think she went to a doctor. Anyway, especially as a type 2 diabetic, as unmanaged as she is. Steps include how to avoid it. Good hygiene at home. Which I think this is questionable when it comes to our friend Foodie. Best way to reduce the risk of sepsis is to avoid infections. Steps include good personal hygiene, like washing hands and preparing food safely, avoiding unclean water or unsanitary toilets, getting vaccines recommended by local health officials. I'm sure Chantel has not had a single vaccination that is appropriate for the country of Kuwait. Eating a healthy diet. Well, we've already lost there. We've already lost there. And you want to treat it early. You just want to treat it early. And then if you have any antibiotic resistance. So that's one of the things that I have thought for. Eloise says, I've had boils from ingrowing hairs, very painful. And even with perfect cleaning can be very problematic. With uncontrolled diabetes and bad hygiene, it could jump to sepsis so quickly. And it really can. And we know that a lot of you have probably already seen Foodie's boils. So we're going to dive into her boils. And then we'll chop over to a little bit more about some of those skin lesions. And we'll talk a little bit about necrotizing fasciitis next, which is one of the, obviously I've seen patients with sepsis. But one of the worst things I have ever seen in my life. And be prepared. If you don't like things that are gross, cover your ears now, folks. Because it's one of the nastiest things I have ever seen on a human being in my life. I promise you, some of the things that I saw on hospice with wounds would outdo a horror film. Because these are real people that were suffering from these things. They were so far gone by this point, I don't think they really were. I don't know. I mean, they obviously were still hearing. I mean, it was horrific. But as I was saying earlier, a lot of people do not see, especially men, ingrown hairs on their backside. And they obviously have hairier butts than women, It's nature. And if these ingrown hair gets trapped and you don't notice, or if you feel pain, you don't really take care of it, these also can turn into a disorder called necrotizing fasciitis, which will take you out. Necrotizing meaning eating death. It's like it literally eats the skin. You had 2 boils in a month. You went to get your sugar checks. My sugars are fine. Good. I'm just prone to your ETS. Yes. And obviously different types of disorders are going to make you more prone than others. Yeah. And this thing with the necrotizing fasciitis, it's probably one of the most horrific things that I have ever seen in my life. It literally ate out this gentleman's rectum. I'll use medical terms. And then it took out the whole entire back of his left leg. So he was just literally bone with some cartilage. Just an enormous wound. I mean, he was on a pain pump by this point. And my friend was like, at the hospital, the nurse I was working with on this hospice case, she was like, because family was getting wild too, obviously. I mean, it was horrific. It was the most horrific thing I've ever seen. Commonly called gangrene. No, this is necrotizing fasciitis. It's different. It's a little bit different from gangrene. Totally different. Like gangrene has a different kind of smell. I mean, it smells bad, but this is slightly different. Slightly different from the gangrene. Slightly different. I mean, not dissimilar, but necrotizing fasciitis is a lot worse. Oh my God. It's one of the most horrific things I've ever seen in my life. It's flesh-eating disease. That's what it's the other name for it. Let me share this tab instead. Gas gangrene. So yeah, it's a type of gangrene. So I do apologize. Gas gangrene. So it's one type of gangrene, but it has other types of parts to it too. So it's not just gangrene. Thank you. Thank you. Yeah, I was about to say maybe it was the gaseous gangrene because it has like that smell. It smells horrific, and it's just the nastiest. And it can come in including cellulitis, epididymitis, gas gangrene. So it's that one. Orchitis, testicular torsion, toxic shock syndrome. Necrotizing fasciitis is a serious life-threatening infection with the mortality rates ranging from 20 to 80%. Poor prognosis has been linked to certain streptococcal strains. I'm telling you, I've seen diabetics get an ingrown hair on the butt, and it has literally taken out all of this, like probably the gas gangrene actually, but it was literally necrotizing fasciitis. This is how they stated it at the hospital. And you go into sepsis too. Oh, it's very high mortality rate. And I've seen it with the ingrown hair. Oh, that's a picture. Oh, don't even want to show that. Oh, it smells. It's the worst. Oh, the wound vac. That's for comfort. Once these people get that going, I mean, I've seen people survive, obviously, but if you don't catch it quick enough and you just let it go and laugh and lie around like Chantel, you're gonna so those are the two things that I really and they all link together. Whether it's the gangrene, the necrotizing fasciitis, the sepsis, the wounds. Oh yeah, they can eat. Oh yeah, I saw this thing. This thing ate through this man's like. You don't want to know, people. It was gross. I mean, he came in with like 20-some documented wounds on one leg. And I literally said to the lady, my colleague, she's like, how do I document this? I said, it's one big wound. So he literally measured from the top of his rectum all the way down to his heel of his foot. Because it was all the way down. And we just had to stuff that thing. And I just remember putting a bunch of zero form. I was like, this is just a mass smell at this point. I mean, I don't even think it was just, oh, gosh. Oh, I don't want to gross everybody out. It was probably some of the nastiest stuff I've ever seen in my life. That's why this stuff is not funny. It is not funny. Catherine says, remember, toxic shock syndrome got very in vogue to make us all terrified of using tampons. Yes, and it does happen. It does happen. You will be like throwing up and sick and all sorts of stuff. I mean, these things really do happen. I mean, it's really bad. It's an aggressive skin and soft tissue infection that can cause muscle fascia. That's what I've seen too. And subcutaneous tissue necrosis. That's like tissue death. The infection typically travels along the facial plane, which has a poor blood supply. And you have to think that Chantel, with her weight, she has very poor blood supply because your blood vessels have a really hard time trying to innervate that adipose tissue that Chantel has so much of. So it's like even worse. So her likelihood of getting, in the way she just doesn't clean and she doesn't really seek care and she doesn't take care of herself. She is more, and she dresses in all those heavy fabrics and doesn't wear anything light or airy. She is so potentially at risk for all of these, especially as she's starting to get the boils, in my opinion. I mean, that would be something, I mean, it's just beyond just the other. If she's starting to really get these things, which I could see she would. She's got to get debridement. Oh my God. Oh, so those are two potentials. Sandra said she had blue and purple bruises all over her legs and feet. Oh, that's like, sounds like poor circulation. You know, that sounds like poor circulation. Oh, oh my gosh. What do you think, Eloise, about the blue and purple bruises all over her legs and feet? And she could be just knocking into things and not even realizing because she's so diet. I mean, that's important. Oh my gosh. We're going to get wild in the chat. Melody says, I had a septic knee joint after a total knee replacement. The incision healed beautifully, but there was bacteria growing inside. Last year, if anybody was here on my channel, we all know a lot of times the reasons why I was down a lot and a lot of times why I wasn't live streaming or I was not on camera was specifically because I had such a bad infection and it was in my nose, which is so scary because it's so close to your brain. And it took a long time. It took a good 6 months of being persistently on antibiotics for it to finally go away. I mean, I was so sick. I feel like a totally different person to where I was last year. So I am so sorry to hear you went through that. And it's just weird stuff. And they think maybe the bacteria was potentially in the graft that they did to do the septal deviation repair. So it's like I love the fact that I can breathe, but I hate the fact that I cannot, that I had to go through the rest of it. But I'm glad I can breathe. I'm glad I can breathe. Easy bruising. How's a diet? Exactly. Well, yeah, the lack of the vitamin K. Yes, that makes sense. Yes, because yes. Oh, well, she knows she doesn't eat anything healthy. So I wouldn't be surprised that she bruises easily then. Yeah, vitamin K would be the antidote to somebody who's on Coumadin. So to make you less susceptible to being so coagulated in your blood that you bruise so easily, then you obviously would have more vitamin K in your diet. That helps with that, with prevention of that. So Chantel is probably somebody who's not eating a lot of green leafy vegetables. And so I would think that she's very lacking in vitamin K. How often do we see Chantel eat spinach or kale or broccoli or anything that would potentially provide her with any vitamin K? And if she did have salad, it would probably be iceberg lettuce, which is like literally eating a piece of water. So yeah. Hey, come on in. Medical. Yeah. Oh, her eye issues. Oh gosh. Well, that's probably diabetic retinopathy taking over. That would be my and then all the sort of difficulties that come along with the start of diabetic retinopathy up to the point where she finally goes blind in one eye because of all the microvascular growth that has like come and grabbed hold and pulled her bloody retina. She never eats anything green, just cheese. Well, cheese not green, Angel of Glass. She's not considered a vegetable. Sandra says she never eats anything green. Hell no, she never eats anything green. Melody says, I had surgeries for antibiotic spaces and revisions at UCSF over a period of 3 years. I ended up with arthritis and the infection never returned. Well, I'm glad the infection never returned. But that is one hell of a journey. Sorry you had to go through so much. That's stressful. The stress alone, too, when you're just dealing with medical stuff, can obviously make a difference in your ability to heal faster. At least Chantel doesn't seem to give a monkeys. So, I mean, if one thing she will be able to do is heal in the respect that she seems technically to look online as to having no stress. though she is begging, which is funny. She said you got your IOCT over the counter, $9 extra at the opticians. Oh, that's what your eye over the counter was, £9. Well, don't tell us all that stuff. I've been watching Sarasota Tim, and he complains all the time about how much his eye drops cost. We know what it's like here in the States. Okay, so let's go to Chantel's boils, and I've sped her up to 1.25. God, this is a great view, Chantel. This is just this choice girl. And then we'll just kind of skip around. We won't listen to all of this because I know a lot of you've heard it. Just for me to kind of hear a little bit about what she says. And then we'll take a look at this update that she has in this overview of her boils and carbuncles.
Boil story once. Please make it a good luck, Mike. Justine, Natasha.
Well, I can tell you that something that's not going to help her vasculature and healing is the shisha. Smoking is contraindicated for skin healing. I mean, it doesn't matter where, really, or any healing in the body, to be honest. It's not beneficial. So if she wants to manage that boil, I wouldn't suggest just lying horizontal smoking shisha. I don't think any of this is going to be beneficial. She looks terrible. I see that one eye is looking like she's got a lot. Has she got like pressure issues in that one eye? I'm actually not looking at the bulge one as much as the one that's just swollen on that one side. Oh my God. That would be the eye I would start getting concerned about. All right, Chantel.
Well, it's not good, Samaria. Our queen of dessert parmesan.
She looks
The
hot.
boil content.
Well, Carl, we're talking Chantel. We're on somebody else tonight. Come on in.
Gourmet veggie with white sauce. Wow. You drink the garlic butter. Parmesan on the foil. Eggs on legs.
Yes.
You're moving out.
She does.
Where are you going?
Oh, Chantel's whole life is a lie at this point, and some is truth. Smattered with a lot of lies. To herself, a lot of delusion. I wouldn't even know where to start with Chantel's mental health, to be honest. And obviously, I do not treat or diagnose, as we know. I have looked at many different things with Chantel. I don't know about the narcissism. Well, sometimes I don't know. She's got deeper insecurities, obviously.
I don't know spicy mayo.
She got some personality
disorders, though. Thank you. Not feeling great. Boiled Korean. YouTube over. So I don't remember I don't remember blocking you, but I'm like, how come you haven't been in the chats? What the hell's going on? Make chicken? Ugh. I'm pretty sleepy. So this is my bedroom.
Potentially borderline. There's certain things that you have with those types of disorders, you have to reach a lot of criteria. So I almost kind of wondered with her and her if she's somewhat histrionic, actually, but she doesn't, because she used to seem more that way because she used to dress more like outrageously. And so I almost wonder if she was like actually more histrionic. But she's kind of reversed that with this style of dress, which provocatively, people tend to dress more provocatively when they're histrionic. So she kind of maybe falls into that area, believe it or not, potentially. All right, keep going, Chantel.
The made bedroom piece. Yeah. Well, it's not that clean. But... Thanks, everyday Becca. How you been? Hey, UCP.
Potentially.
Okay, do you think this is as many people are going to come in or what? You just don't support Starbucks if you're not going to smoke. No, I'm just joking.
Oh,
I'm kidding, Samir. I buy from there too.
oh, that sounds wild.
How do we
Thank you,
unblock
Sharon
Bake
Gale.
Korean? Are you blocked?
I cannot believe this is her at 1.25. I might have to speed her up a little bit more. She talks very slow. I forgot how slow Chantel talked. All right, Chantel, get to something interesting. She said that she needs to get 50, as I think everybody knows. She said that she had to reach 50 likes in order to talk about her boil. I don't even know how many likes I have at the moment. Make sure I have at least 50 likes so I can keep talking about Chantel's boil. How about that?
I don't know if he's in the chat. I need a llama. I know. I've been using this. I gotta wash it. I dropped diet soda on it.
Her mouth? Say
Yeah,
what
I
pulp?
like it.
What, this pulp?
Nice, eggs on legs. Enjoy the bees. Not really spicy. Well, it depends, spicy mayo. I do get different kinds. Thanks, Be Free. Okay, if I make...
This is just a picture of health just here, isn't it? This is just... why would you even bother to put your lip gloss on for this, Chantel?
somebody super mod for like a minute to unblock Bake Korean, are you able to do it?
That was really fast. Sorry for anybody with this shisha.
Yeah, but not just anybody.
Sometimes she speeds up.
Okay,
It's
trust
scary.
me, BBJ. I'm taking it away right away, so don't worry. Justine, okay. You can do it?
Thank you, Delulu
do your thing, just...
Well, we can continue talking about Chantel's boil then, because we have 50 likes. Well done, every community. I'm just teasing.
Let me know when you've done it, please. Oh, Rosemary, BBJ. Bear, hello.
I know, this eye looks terrible.
BBJ.
Awful.
If I make you mod, you promise not to be to misbehave and block.
Oh, Dimmy is wild. We'll get to that at the end.
Hi, Rosemary's. Horse health. Oh no, kind heart. Sorry to hear that. What's that? Ida. All right, BBJ. Since I know it means so much to you. Fairy tales.
All right, Chantel. You're supposedly about to go into septic shock. Where?
Okay, Bake Korean, somebody is going to unblock you. The song by
I'm glad to see that the quality of Chantel's content has markedly improved over the year. It's the quality that I think that she really makes sure that her audience is getting. Along with a good amount of health misinformation.
Beach Boys in my room? No. Hey, Lovato. Actually, I didn't eat too much pizza. There's still leftovers, so I don't feel too bad. Kifek Enta by Farouz. Farouz is good.
Yes, she does, Chocho.
Hey, Loof. I can't be trusted with such power.
Ooh, Carl.
BBJ's been around for a long time. Hey, Sarah. Oh, sorry to hear that, Bear.
You mean you just didn't ignore the boil and let it fester and pop like this lady supposedly does? And it's going to get graphic. I'm just warning everybody.
I'm always here for you in DMs if you need me. Okay.
Happy birthday.
All right, Candace. In my house, Mary Jane girls. Okay, you want to know the update? Hi, little Nitty. Tricky. All right, if we get to 50 likes, I'll tell you the update. I got to start bribing you guys. You don't want to like my videos. You don't want to watch my content. You don't want to do anything.
Well, Chantel, can you really blame people? I haven't really watched too much of your content in the past. I mean, I watched through others, but I mean, not to make commentary. And you're still lying sideways on a bed in Kuwait. So what do you anticipate for your audience to be coming to do? They're not there to entertain you. I think that's something that you haven't quite had a grasp of yet. I am here hopefully to educate and entertain. And I know that the people in the chat seem to have a good time and seem to know one another and like chatting. And I enjoy watching that too. And I'll highlight people as well. So, yeah, she reminds me too of a teenager, Sharon. Absolutely. I mean, it's just like, I'm not sure what I think she was able to do so little in the past when YouTube was a platform that was much newer, had probably a lot less competition on the creator side. And she happened to go into a niche where she ate, and she found like, oh my goodness, I can sit here and eat and make content. And over the years you can kind of see even like her personality shift somewhat to the sort of slightly milder Chantel at the very beginning of her eating adventures on YouTube, to the very sort of sassy, blocking everybody, demanding people to like her content. And can you imagine that your bait to try to get likes is to discuss your boil? I mean, I talk about it from a medical standpoint. And obviously, the fact that it shouldn't be treated this lightly if Chantel really is experiencing this. And that's very bad information to give your audience, Chantel. But now changed on this. So thank you for saying you like my laugh. Nothing changed with you, Chantel.
Chantel's private boil. I'm oozing. Ew.
50 likes.
Thanks for the super chat. I'll take it, I guess. Why is it such a big deal? I have a boil. Boil Korean.
Why is it a big deal that you have a boil? Well, Carl was just very open and honest and said how he discovered he had type 2 diabetes was from having had a boil. And we'll take a minute at a little bit about these as a skin lesion for diabetics. And so either you don't take it seriously, then if it's not so serious, then why bring it up as a topic of conversation? I've heard multiple theories. One theory I heard that was interesting was that potentially you don't really have this, and that there could be sort of people with fetishes around people having medical things wrong. And so somebody is paying for you to create a story around having this nasty boil in order to kind of, satisfy the needs of a fetishist. Just some wild people on this platform. I'm talking about Chantel. And some of her, oh my gosh. So yeah, that's potential. Or she really does have a boil down by her vagina. Let's just use a medical term. And she is taking it a lot too lightly, considering it could become very life-threatening very quickly, especially in regards to sepsis, which could be directly from having a staph infection like that from the skin, which is very easy. Staph is all over your skin. It's not difficult. And if you're not having these boils properly lanced and drained, then you're kind of letting all this bacteria out, and not in a good way. And that can cause for bigger issues. That's why it's so important for these types of things, especially with diabetics, to be managed by medical professionals, because you often may not feel too when you're getting certain types of skin lesions and things happening because of the neuropathy. So your sense of pain is somewhat also altered. So you may not be actually really understanding how much pain, because your pain receptors aren't really fully functioning as well, in my opinion.
I know you're watching. I'm joking. Okay. Come on, 50 likes. If I can't even get 50 likes, I'm retiring.
Best
Hey, Methadone.
the first date? No.
Like and subscribe. And join my memberships. Oh, yeah. And maybe pay for a trip to Disneyland. On today's, teardrop will come in after the boil talk, maybe.
You're funny, Eloise.
I like the name Methadone. Okay, we have 50. Okay. So I didn't get my boil lanced yet because, okay, I've actually forgotten a couple of times I've had a boil. There was...
How do you forget? I mean, is she just forgetting that this has been a reoccurrence and more than once in the past, or that she just forgot they're on her skin? I would think it was both would be potentially possible with Chantel. That's a great Chantel. That's not a good Paul story.
I've had a boil, a problematic abscess. I don't think it's a boil. I think it's an abscess, like 5 or 6 times. Okay, and since the villa. Now, little boils like this I've had, but they go away on their own. They pop, they go away. Teardrop, hello! You came in just in time for the boil talk. I'm not going to talk about it, gross. I'm just updating. Make a wish trip. Yeah!
No, we'll get the gross on the health update. So don't worry, guys. We'll get the gross soon. We're not going to listen to all this. We're going to listen to the main part about the boil, and then we'll move on. All right, Chantel, keep going.
Anyways, so, hey, Karen. A boil or an abscess? Well, Laura, they're very similar, but like an abscess, like a boil is generally just a small, not problematic boil. It goes away on its own. I don't have a hairdryer.
It was fake.
Anyways, so, yes. Hi, Monira. I've been wanting to wait a bit just because, like, number one, the hospitals on the weekend, I think they're like not as fully staffed. And Sunday, like tomorrow, Sunday, I have is regular business hours, and I have to see my doctor. My endocrinologist, or whatever you call it. Oh!
Well, I think Angela Glass said that she admitted it was a lie. Or I guess Chantel told on herself. One of the two. Or maybe a combination of the two. But if you are a type 2 diabetic and you have a boil, remember, you may not have the same ability to sense pain as other people. And just be aware, it could potentially come into something pretty nasty. So I would suggest that you maybe not go to the emergency room, but if you have the ability, go to an urgent care. You probably would be seen quicker and for less expense, and let them lance that boil and potentially give you an antibiotic if needed to take home. Maybe they can even culture it and find out a little bit more. So I think it would be important. And like I said, I would not necessarily go to the hospital. I'd just go to an urgent care and get it taken care of here in the US. I'm sure in other countries it's differently. So I think that sitting here, if she really did have a boil, especially with how uncontrolled her diabetes is, I would not recommend just lying in bed waiting for the weekend to pass. That potentially could be more opportunity for you to become septic, because it can happen quite rapidly and time is on your side if you can get to it quickly. So you need to be quick. You don't just lie there. Terrible advice.
Oh, really there? What kind of cheesecake? Italian cheesecake. Disneyland. Yeah, Troy used to go over the crowds.
Mercer too. Yes.
Now
she needs to definitely get all of that and cultured. She definitely needs to get cultured. You can't just let that go. Something like Mercer, God. You know? That's also highly infectious to other people. So, you could go sit your, just, it could get messy. So, we used to put, they stopped, doing it so much, but we used to swab everybody's noses in the hospital for MRSA. They had MRSA. They went on contact precautions. So these are not things to mess with. Yeah, definitely the MRSA and staff. At least some staffy too. some Staphylococcus aureus, all of those. No, Chantel probably E. coli. I'm just teasing.
Oh, here. Okay. Yes, I'm getting to your questions here. Now, I've gotten mixed responses. Sometimes the doctors will advise to lance it, and I've had a couple lanced. Sometimes it just goes away on its own. Hey, NM, like I've had them drain on their own and just go away. I need a detailed description. Okay, close your ears, teardrop. So I think this one developed from like
the same
hair growing in
doctor,
because I can see
she and Tim see the same doctor.
like a hair follicle, and then there's like so there's like it looks a bit white right in the center, but then there's like it's like it's growing like this big.
MRSA is just methicillin resistant Staphylococcus aureus, and that staph is on anybody's skin. So I mean, it can happen. It's part of like your body, but if you have a weakened immune system or something of that nature, like probably Chantel has, then or you've had surgery, that's why it seems to be more connected with hospitals. Then what is already on you, it actually can then turn into a really nasty infection. So that's kind of how that can often happen. But you often swab a lot of people's nose, probably have MRSA in there.
Around, like it's not a ball. It's like, but the area around it, I can feel it's like really tender and like getting firm.
Oh gosh,
so
yes, absolutely. And that's so gross.
But
we know that Chantel probably has problems with wiping down there. So she definitely could get, I know, I say these things in jest, but not really. Because it's so easy for that poop to get in something like that. Can you imagine? Is she not wiping the right way or being properly clean down there? You could get your poop in that open sore area. And you got, you're going to be on a wound vac, girl. Look at the face. This is the face you should be. That's the face you talk about lancing. Chantel, if this is all true, it's really not pleasant. And not pleasant for other sort of things that I can think of as far as infections and diseases that could come about that I think you're just absolutely oblivious of. And you just lack insight and judgment. You really do. It's something is deeply, inherently wrong. I've looked at different pathologies for her because she definitely has personality disorders. All right, keep going, Chantel.
Been this bad before, but it's not popping and it's painful as hell. That's why I'm laying down. So I'm gonna go in the morning with Salah. There's no odor. No, not yet. A new fupa ball. Pretty much.
That cat lady life.
It feels kind of like there's also cellulitis or something. Throw in your pits. Because
well, the PK would be better.
The area around is like red.
Okay, let's hear the description. She said there was a hair growing in there, which is why I started thinking about sepsis, because that can happen, and necrotizing fasciitis, because I know that can happen too. Both can come about from an ingrown hair. That's why it's so important to make sure your razors are nice and sharp. And another way to stop ingrown hairs, a little trick is to before you use your blade, you just get like what we call isopropyl alcohol, 71%, maybe. I think it's 71. Anyway, you just make sure you pour that to the blade and let it dry for a second before you use it. I pour it every time when I'm doing my under armpits, and it will help prevent those nicks to cause any ingrown hairs. Anyway, that's a trick of the trade. But that's nasty. Chantel, you're nasty.
Yeah, there's no odor. There's no odor until it,
Hey, girl.
I had many showers, hot, and I just stay there and let it run on it, but it doesn't do anything.
We could spend days.
High blood sugar levels. Yeah, my blood sugar levels are a bit higher than usual. That's why I want to see the doctor tomorrow. Just get all fixed up.
Oh, yeah, all fixed up, Chantel. I think that's not possible. One visit to the doctor like that. And the way she just doesn't understand, like, the difference between what insulin does. Oh, she talks about that somewhere. It's just absolutely incredible how little she understands about insulin and its role in the human body, considering she takes effing insulin. This is how really just so uninterested in understanding anything that involves her body to any extent. Chantel just wants to magically wake up one day and all of her problems with her body be gone. And she just like come out with a banging body like a Victoria's Secret model. And that's never happening. And the way you take care of yourself, I can promise you, you will be dying with that CPAP on. So get rid of that, Google.
I've had to have them here before.
Oh,
there's no update. Yeah. No, I didn't go yet either because I don't have a fever. I've taken my temperature. I
don't even know which part, if there's anything to believe on that. Well, I'm glad you don't have a fever, Chantel. That's one less symptom of sepsis. But we don't know what your heart rate is. There could be other signs that you have are becoming septic that have nothing to do with the fever, though. That's a very common one, obviously. All right, keep going, girl.
I don't have any of the symptoms, like early warning signs of sepsis. I know it can. Hey, Clear Focus Studios.
Oh, she's talking about her sepsis.
IV for the boil as in preventative antibiotics.
Oh, I'm sorry to hear that.
Yeah, ECP. Hi, Plain Cheese. The problem is that an abscess is full of infected stuff. It's when it travels. It's, I feel like it's contained right now. So disgusting. I know. You need a medical.
How do you know it's contained? I mean, just because it's in the skin of the boil, but if you don't have it professionally lanced, then it's not contained. And you probably can't really see down there very well, Chantel. You're probably going to have to get a mirror and actually to kind of look at.
Great size tub. What? Maximum space.
What?
Why did I need antibiotics?
See, the thing is, with her laughing and stuff, it's kind of like, is she just really so delusional and so reckless with her physical health, which we know she kind of is, that she just doesn't even care that she could have a boil that could go sepsis in her body? She'd be like, I'm all right for the moment. I've been fine in the past. Well, one day you probably may not be fine, But I think when I almost suspect that when she doesn't really feel good, this is when we see her being more horizontal. I'm sure she feels the effects of her body more than she lets on. And I think this laughing and all of this, it feels not forced, but it feels like it's just like she's shutting out certain things in order not to really sort of deal with it. Like she just doesn't deal with it. If it's really truly happening, she doesn't deal with it. Or she's just a compulsive liar and that's why she's just happy laughing. But I would, think that, like I said, if she'd been out and about moving a bit more and more friction and more rub, the chance of her developing some type of boil down in her area, it's very likely.
A bad memory. Like, I'm actually a little scared. Remember the last time I went to the hospital in Kuwait?
Disassociating.
Do you guys remember what it was for?
Yeah. Oh, very maladaptive behaviors.
Show us. I can't show you.
Yeah, she is very delusional.
Thanks, Max in Space. No, I'm not a doctor, so I'm going to go tomorrow. Hero needs to be held accountable. Just for talking.
I'm glad someone's telling her she's not a doctor. But she's so, cavalier about it. She just doesn't care. I mean, between the shisha, that will take out a limb too. The smoking. I mean, that's how a lot of people end up being amputated. It's more from having poor blood flow in the femoral artery due to vascular complications from smoking than anything else. So I guess she just really wants that body just taken out. Whichever way go first, food or the smoking, whichever way. She wants to be amputated. Keep going, Chantel.
Talking about it. I said before you came into, I said, I think teardrop's going to come in after the boil talk, and then you came in right before my update. No, I can have trolls. It's okay.
Oh, very interesting.
You guys don't have to be too block happy. I'm all right now. I'll just ignore it.
But the difference is that at least some people were trying to ascertain what was happening with your eyes. And I'm glad somebody at UVA was able to obviously be able to give you a better diagnosis, and that can be difficult and it's frustrating. But at least you were trying to seek medical. Chantel, look at this eye. This is more concerning than the bulging one over here. I mean, yeah, she looks like she's just absolutely. I mean, Chantel is not the picture of health. I don't think she feels well. In my estimation, when she's always doing this is because she's tried to go out and do stuff, and now she doesn't feel good. So she does need to come home and literally take it easy. But she has to make content every day. One, because otherwise she'd be very lonely because she's pretty much alone. And Salal's nowhere to be found. He don't care about this person.
Yeah.
He don't care.
YouTube lover, no, I'm gonna go tomorrow for sure. That way, 2 birds, 1 stone. And honestly, I want to go when there's full staff in the morning, so I could ask for a female gynecological thing.
I know.
Yeah, I did. But I'm not sure if it's that. I've had one other boil here where my bra strap was from the rubbing. That was a while ago.
And see, that's why if she really does have it down in that private part, she had been a lot more active recently. That probably potentially could have caused a lot more rubbing and a hair getting rubbed more down there. She's not getting down there and keeping anything shaved or clean. She tries to say she shaves or something down there. But then I wonder when she went to that local live thing from what I was watching, that they supposedly looked at a photograph of her private parts and the consensus was she does not shave.
Want a cat from Kuwait. The new Switch, yeah. Try even.
Oh. Oh gosh. Tim's terrible. Tim terrible.
Yeah, if you want to know. So it's very heavy. It hurts like hell.
Sanitary reasons.
Thanks, Harper.
Less smell.
But I don't feel nauseous. I don't feel like I have a temperature. So I think I'll be okay till morning, inshallah.
So is it you don't feel like you have a temperature, or you actually took your temperature, Chantel? So these are 2 different things. You said a moment ago you took a temperature, you didn't have a fever. And now you say you don't feel like you have a high temperature. So which is it? She doesn't know.
Folliculitis.
Folliculitis.
Ew, eggs on legs. That's what he's the human equivalent of, but still.
You'd be lucky for folliculitis.
Hey, Nicole. Well, I'm happy you at least said hi. I do have chamomile.
Okay, yes. All right.
Someone probably doesn't prefer I talk about it, but whatever. He's like, let me guess, you told them all about your boil.
Exactly.
I'm like, it's not right.
I mean, we don't shave at the hospital. We only trim because we didn't want to nick people and cause potential skin infections. I mean, having very small cuts or lesions in the skin, if you do not wash or keep them just clean, you just soap and water. You don't really have to be throwing hydrogen peroxide. That's the worst thing. But Chantel is not a soap and water person. I don't care what she says. She always looks filthy. I don't know how she manages to do it. She puts on, she does not look clean.
Right on. It's not right on the fupa. So it's like,
oh,
it's kind of on the side.
Lady, thank you for becoming a member.
Okay, let's name it Susan Boyle. My husband, his working days would get boils all the time because he worked outside in heat. He could barely walk. Yes. Where did he get them? On his feet? Yeah, they're very painful. It feels like there's something growing inside of it, like an alien.
Well, that's what I'm suspecting, is that Chantel's masking here something. And Sandra, disassociating from really what's happening. Because her eye looks terrible over here. This is not somebody who looks well. And she's just smoking shisha because Chantel doesn't like to face realities. Chantel is not someone to face reality. If she was somebody who faced reality, she wouldn't be sitting in this situation in Kuwait. she'd be at home in Canada addressing her taxes and trying to get hold of her life, because there is going to reach a time where she will not be somebody able to continue with anything on YouTube. And then how does she provide for herself for the rest of her life? Because we know Salah is not going to be providing for her. That's not happening. So she's deep in the delusions here. So she just runs away from everything. She has no capacity to really face anything situationally that's hard head on. That's why she can't do therapies. That's why she doesn't really manage her medical problems. That's why she doesn't take care of her taxes in Canada. These are my opinions. But I feel that she really is somebody who is we know, deeply immature, and definitely doesn't want to face the reality of anything. It's really sad. Okay, go on, go.
It's overcast today. Oh, the gray curtains. Look what's on my TV.
Thank you, Hatley, for becoming a member. Yeah, I think she has given up, Sandra.
No, the fake. Here's my shisha.
I think she has given up.
I have a candle going.
I think Chantel has secretly given up. I don't think she'll say that to the Beezers. I think she'll keep perpetuating this fantasy that she's going to get back her health and glow up and this, that, and the other. Has anybody seen any concrete evidence that this person has any intention of doing that? And I know that we've seen stories where people turn their lives and stuff around and lose a lot of weight and this, that, and the other. I'm not saying, but Chantel seems very full from that point of ever it happening. She literally has a treadmill sitting there. And I swear, Julia makes more use of that treadmill than Chantel does. She's no care.
And this is the...
Yeah, she has absolutely given up.
You can't see me much, but...
Yep.
There's my bed.
Don't care.
I'm on my bed right now.
So I shouldn't care about even seeing the doctor. It's a waste of money for her.
That's my bathroom over there. That's basically just my bedroom. Nothing fancy. Courtney, Jessica Boyle officially.
I think probably talc is not a good plan.
Isn't that her? Isn't that a real person? Thank you for the super chat.
I think there's like probably talc isn't a good idea. I think there are other types of like barrier type creams that you could put on. She probably could use like Destin, like diaper rash stuff. I know it smells bad. But probably Destin down there, like you would use for children in order to, for the diaper rash would probably be better down there than her using talc, in my opinion. So I would use stuff, and then obviously you've got to put stuff underneath the breasts to stop all the rashes and the sweat. I mean, there's a lot of stuff. And then I don't think she can manage it all. She doesn't even see a dentist. She doesn't see anybody. She's, she's got a lot of work. I mean, it's just like, and then, who's there supporting her? She's be literally at doctor visits all day.
Yeah, there's a light there. Oh, you can't unblock baked?
No. Yeah, the treadmill's a cat bed now.
Okay, I'll get a lot to do.
Chub rub. Yeah, some chub rub.
I like boiled Korean better. The name is funny.
How old is she?
Yeah. Show us Salah's bedroom.
She just had her 41st birthday. She just turned 41. 41.
This is it. If you mean the man cave, I don't think they'll want to show that.
Oh, yeah.
Well, don't worry about it. I'm going to go tomorrow. I might have just seen before you.
I mean, usually you're going to see it in the yellowing here of the sclera. When she filters stuff so much, it's hard to tell. But the skin tone, too. I mean, I think she's just not doing well. I mean, she really doesn't take care of herself. You can't expect the body to take but so much. And especially with all the different health conditions that she has, that she doesn't see anybody for. I mean, we know her diabetes is absolutely unmanaged. It's going to wreak havoc on her body. It's just going to.
You came in so she could unblock Big Korean.
Her heart's not going to take it. Yeah, you're 20 years older
That's
than
okay,
she
Justine.
is. Hard to believe sometimes.
How do I feel bad removing
Yeah,
the
she's
moderator.
a hot mess.
I'll just add you as standard.
She is a hot mess, Terry.
I have to get Salat to do it boiled Korean. How can I unblock you right now?
She's the original dry begging, blocking, haters gonna hate. It's Chantel.
Justine is always super sweet and nice.
Oh, it makes it
Maybe
feel
eventually
terrible,
when
I'm
she's
sure.
Hey, Vanessa.
Tired.
This is my bed. This is our bedroom. Yeah, we both sleep here.
Yeah.
But this is Salat's side of the bed. I sleep on this side.
Oh, yes. Oh, well.
No, I don't think it was Salat. He said you're not blocked.
I promise you, as a runner, I always had this special stick glide stuff that I would wear so that I could get going like this, you know. But Chantel needs some extra strength protection, almost like diaper rash stuff for her vaginal area. Probably, she's probably beyond. Chub rub probably good under the breast and between her legs and stuff. She probably just needs to dip herself into it. I would not want to see the condition of her skin. Really, gosh, oh yeah, she could put some of that on, but I think she could do some diaper destined.
So that's why I'm weirded out.
But yeah,
Hold on.
Diabetes makes you feel terrible. She has edema. Yeah, she looks like she has edema. Yeah, she does look edematous right here. Chantel, what happened to your sound? Did Chantel lose her sound? Is that Chantel who silenced herself?
I said I would give you a vlog from the hospital, but then
oh yeah, okay.
Remember you said you went to sleep to flirt like Grandpa Joe from Willy Wonka?
Probably why she has them reoccurring.
We tried it once, but
all right, Chantel, you gonna talk more about your boil?
It didn't stick.
She talked more about her boil through here. I know she does talk something about her diabetes. That's
just
terrible.
rewind a little bit.
What does she use that pre-surgical soap?
You guys want to watch funny YouTube videos or something?
Oh gosh, it's the I've got some here in my house. The Hibiclins, the that's the name of the brand. It's that particular one. I mean, that is not a bad thing to use when you have MRSA. You would use Hibiclins to keep the skin clear. But yeah, I mean, that's not a bad suggestion for her. I mean, that would at least keep her sanitized down there. That would at least help with any at least it would be a good solution for cleaning that area. So I would say that wouldn't be bad. That Hibiclins, chlorhexidine. That's what she needs. But the thing is, that doesn't really foam up and stuff. It's weird. But it is all the stuff, you know, that's the one that if you're about to have surgery, they may recommend either at home that you wash in that and that you get it ahead of time, or they may clean your skin ahead of time with it as well. But yeah, it would be good. You want to get her into some sheep dip? The sheep would be scared. I wouldn't do that to the sheep. It's hard to feel young for someone as young as her to let herself get into this condition. Oh yeah, this is a personal choice. This is all Chantel's choices. These are all her choices.
Anyways, I need to get this taken care of. Air fried Korean.
I don't think she does though, from what I could tell from the update. This eye looks terrible.
I can't. It's copyrighted.
What is up? This eye is bad. This eye looks really bad. I mean, like, when you don't have managed blood pressure, which I can't imagine her blood pressure is managed, especially with the amount of sodium that she intakes. And then you can get pressure in your eye, like your pressures build up. That, then leads to things like glaucoma, obviously. But this is, oh, terrible. She's not well.
Go to the doctor.
Hey,
air fried
Jennifer,
Korean.
come on
By the way,
in.
actually, yeah, I said in my mukbang there's a Wingstop.
High as a kite. Oh, that too, probably, Terry.
If I have to have a surgical procedure for this, I'm going to be laid up.
Are you talking about a debridement? That's pretty intense, Chantel. That's intense if you have to get that far, girl.
Car fried. No, nobody was removed. Plain cheese.
Oh, God. This one here? Oh, this one. This one here?
It will feel better.
This eye is terrible.
I had to go tonight to the doctor. I probably should have gone earlier, but I wanted to see if it would just pop on its own.
Well, see, that's not good advice, Chantel. That actually could get you into more problems. That, loss of all, that's not good. That's why they try to land to you and remove the fluid, because they're trying to remove a lot of that bacteria too. Just letting all that bacteria be everywhere on your skin, girl. And then you're open, and now you have more chance of getting more stuff into that wound bed. And it's just not a good plan unless you really want to become septic. Or you really want to have a really oh my gosh. I just want to have it pop on my own because I'm too cheap to want to spend any money to see a healthcare professional. It's probably the only reason why she did it in Canada was because she knew it was covered. And she knew she needed to have it done correctly. But now she's in Kuwait and it's out of her pocket. She doesn't want to spend the money. Chantel's health, if she was in the United States, would be wretched. She would hate to pay for any health care here. She would hate it.
It's not. What can I do to make it pop? No, I'm kidding.
Make it pop. Yeah, she definitely needs a debridement.
It's like hard around the area.
Absolutely. If she does have this boil, absolutely. And an antibiotic, probably.
My dumb husband didn't put my yogurt bars in the fridge. They set up for hours. They were supposed to be cold. He probably did it on purpose so he could eat them. Are they the
a lot of
yogurt
disinformation?
Bars? Thank you, Jamie. Haven't seen
so much. It's so bad.
I think so, Becca.
Very bad.
Unless you were a professional at it. Yeah, true. Hey, CD. No, it wasn't Tracy. Is Pillow Day today? I don't want them to pack it. Oh my God, I had to do that before.
Is this the one in Thailand?
I feel like I don't want to go through these things.
Is this the one in Thailand that wasn't really existing? So Chantel, see, the thing is, you cry wolf so much and you've told so many lies. Nobody knows if you're telling the truth. So I think this is partly the reason why your audience doesn't care to send you money just because you gave yourself a vaginal boil. It's nobody's responsibility but yours.
Kuwait. Like, I don't want to go through these things, period, but no, I don't smoke with the CPAP.
Oh, yeah, she's probably masking some pain. She said that one burst on its own, too. Yeah. Oh, maybe it's only in Canada she had impact.
Yeah, it's pretty big and inflamed. Painful.
Oh, hygiene and just.
You've been walking around the heat.
She said she had an ingrown hair, so that makes sense down in that area. And friction burn rub. Remember that Chantel isn't, she's probably very packed down there. So she's just, she's not as open as maybe some of us are. Because she's, overweight. So it's, I've had to do very interesting things with people who have, larger body types, like Chantel literally taped people's penises out the way in order to do things because you can't get to things very easily. So I could see down there it very easily happening, especially with the type 2 diabetic too, because she's not also got healthy skin. And we'll take a look at the sort of this in a minute.
Well, I mean, here and there I go out, but
Chantel,
rage really hard.
how do you
Thanks,
how far do you think?
I have like a needle for my insulin. I put the needle in and suck the stuff. No, that would not be it.
Oh yeah. Careful.
Yeah, I'm gonna go to the hospital.
Yeah.
Did you know
Try
that?
to be
I've watched
it.
videos
It's the
about
YouTube symptoms, Catherine.
You can get them at any. Sepsis is basically your body destroying itself.
God. Yes, they do. They really do, Catherine.
Attacking the invader cells in your own body. Like, it's so weird. One girl got it.
We get a lot of those in the hospital because they have a lot of complaints often because they don't feel good. A lot going on. And also I've heard that, Chantel probably has even bigger bones and stuff because of her weight mass. The bones do get bigger in order to be able to carry the mass. I went to a very interesting presentation about Wegovy and cardiovascular disease. It was very interesting.
From a sore throat, went septic, and she had to get her limbs cut off because they turned black.
Oh
my gosh!
Please don't
really?
even inspiration. See, I don't
have
even
any amputations. Sorry to hear that, methadone.
Oh,
really, Links? It's really common, I guess.
Gosh, that's very high.
But if they pop it, it could still, You almost lost your arm. Oh my gosh! Yeah, just
I believe the technical term is they probably Lance and DeBride. Get some Dakins in there, girl.
Nearly killed your dad. Oh my god. Go today. Boiled Korean. I don't want.
This is terrible.
Grilled Korean. How about sous vide Korean? High blood pressure, high blood sugars. Yeah, probably Rebecca. Anna, really? Oh my gosh.
Yeah. Well, at least that's about the most honesty we'll get from Chantel. High blood pressures, high blood sugar. Yeah, obviously. She does not look well.
I want a fupa amputation. Yes. No, not to joke about it, but
yeah, that's not happening, Chantel. Of course, you just want it magically gone. Magically gone.
Hey, Risa. Ramona. That reminds me of Pete. Doing that in bed isn't the best idea, Brooke. Yeah, we're gonna go.
Sadly, I'm not going anywhere with her, especially to have her.
It can be, especially if you have diabetes or complications. Yeah.
Well, you understand that, Chantel, but yet you're lying here in lack of action at this moment in time says that it's not somehow connecting in your brain. And Salal not going anywhere, especially on this adventure. He's the reason why you have the keys to the car is because he can't bear to be anywhere near you. He literally has checked out from any of your shenanigans, it seems, some time ago. Unless it's just to literally annoy you with Crazy Frog and the neighbors. That's it. And he does that literally to, I think, only irritate you. He just solidly wants you gone, and he doesn't know how else to express it other than with Crazy Frog.
I won't be on here too long.
You, girl.
Maybe we should go now. The hospitals at night are going to be so slow. No, Brooke.
Not common unless you're a diabetic like Chantel, I'm thinking. I don't think I've ever had a boil Lance in my life.
Thanks, YouTube lover. Well, it's 10 p.m. No, I didn't see that strawberry.
So I don't think it's that common.
Sometimes they don't pop. Yeah,
you have certain medical conditions. Like Eloise was talking about.
Yeah. I have to tell them all my comorbidities. Yeah, they speak English too.
Oh, yeah, Chantel, that's another reason.
I'm going to have to stay. I know it. They're going to put me in the female area.
Chantel, yes, you're going to have to stay. Unless you have the money to have a private doctor come to your abode and treat you, then yes, you're going to have to stay. And you may have to stay for some time. It's not going to be an in and out and done. Chantel has zero ability to have patients elsewhere. She just wants to be doing what she wants to do. And if it impedes into her plans of whatever, lying around, eating food, breezing, whatever, then she doesn't want to spend the time to do it. It's literally an inconvenience to her. Her health issues are an inconvenience to her if this was to be taken for real.
Yeah, Sarah. I'm not vlogging the Lansing. Crazy.
Exactly. Or she's lying for attention.
Hospital's open and not like there will be drunken lifestyle.
Do boils have sex?
On the weekends at night, there's always drunken people at the hospital.
Oh, when it bursts, you left with just a crater. I think it depends. Like, I think the skin's obviously going to sink down. And obviously, depending on the size of the boil, it could be cratered or not. But obviously, you're going to have that skin's going to kind of go over the top. And then obviously, it's going to have the pus that's going to fill underneath. And depending on how much pus, and how it starts to kind of affect your dermis layer there, as the bacteria kind of sits in that area, Oh.
Does Kuwait have a punch card? It's free. It's fucking RERBs.
The boils, it's warmed. Oh. No, I don't think it's a recommendation. Oh.
How am I so calm about this? I don't know. I never freak out. I could be near death and I probably wouldn't freak out. That's just how I am. It was full on. No, Pokorny, that was yesterday. All right, I'll see about it.
All right, Chantel. She spent a lot of time talking about the boil.
I have to shave then. Terrified. Our queen can handle anything.
All right, Chantel, I'm going to bring you along.
Yeah, it's very swollen. Very.
Oh. Swollen?
Yeah, Tammy.
See, is she talking? Now, is it swollen around that area? So is it like getting like inflamed and irritated around the boil? Because that sounds like a deeper issue than just a boil. Because, let's go over to this comprehensive thing over here about, share this tab is such real fast. So this was an article, and it's very recent. It's a lot. It's pretty long. It's from 2023. It's a comprehensive overview of skin complications in diabetes and their prevention. And obviously, this could be type 1 or type 2. And I've always spoken about the fact that she needs to check her feet and so forth. But obviously, I wanted to look up the word boil. And so I did. And so they do get these boils. And these are boils and carbuncles. And these are deep skin infections caused by bacteria, which is what I've said throughout this live, such as Staphylococcus aureus, which is the when it becomes methicillin resistant, that is the Staphylococcus aureus, and it lives on all of our skin. And as long as we're keeping clean and we're staying hygienic, then we don't have any problems from this bacteria being on our skin. But if we are not hygienic or we have other different types of health issues, then these things can become problematic, of which in the case of someone who's diabetic, you can get these deep skin infections. And they usually appear as painful, red, swollen bumps filled with pus. Lovely. Boils and carbuncles can occur anywhere on the body, but are most common on the face, neck, armpits, buttocks and thighs. And the ones on the buttocks were the ones that I was talking about where people don't see them and people can get really in trouble with them. People with diabetes are more susceptible to these infections due to weakened immune systems and impaired blood flow to the skin, which I was speaking, that's really through the neuropathy. And Chantel has additional impaired blood flow through the skin because of the adipose tissue. And that tissue is very difficult to innervate with the blood vessels. They do not get through that adipose tissue well. They just don't. And so a lot of times that whole area isn't getting a lot of blood flow. So that skin, that it's just not going to be healthy. You got to get good blood flow for it to be healthy. So there's multiple complications that come from that. And then obviously things like folliculitis, but that's a bacterial fungal infection of the hair follicles, which are small sacs surrounding hair root. Now, she did say that she saw like a hair in it. So does she have a boil or does she have folliculitis? Because she said she saw ingrown hair, and that's more the folliculitis, which can then become septic. And it's usually appears as a small red or white bumps that may be itchy or painful. Folliculitis, again, can occur anywhere on the body, but is most common on the face, scalp, arms, and legs. People with diabetes are more prone to folliculitis, again, due to the weakened immune system and poor circulation. Of which, Chantel, despite her laughing and joking and having the best time ever, she is more susceptible to these things. So if it's an ingrown hair and she got folliculitis, that can be really bad. If you don't get that taken out, that hair, that can get really painful. That can get really bad. That can get crazy bad. So, or does she have a boil? That's a carbuncle. I don't think Chantel can see well enough to know which one it is, but she said she saw a hair in there. I can't, I'm surprised how she saw a hair in there, how she got down there, considering her eyesight not that good. And how can she see down there? She'd have to get a mirror. Oh my God. Oh, can you imagine? Oh.
Mike, I had a painful bump on my fufa on my honeymoon, and I went to the doctor in another country freaking out and turned out to
Oh
be
yeah,
ingrown.
if it's staph, it's not good.
Do you still like the Scream movies, Samir?
Oh
It's not
yeah,
on my
go to
leg,
the
it's in
doctors.
between,
Yeah,
it's like
go to the doctors.
Where the upper thigh, right in the corner where the thigh and the fupa area meet. Hey, I know. Kind of that area, like. She shaved while she waited eggs on legs. What?
Thigh and fupa area. Girl. So, I mean, if she has that hanging skin, I mean, she said it, we had an ingrown hair. How high is your hair going up there, girl?
Yeah, I know, Lynx. Welcome to the blue.
The handsomest man came to join us. Carlo from Tennessee. Come on in, the handsomest man.
Did you watch the Teardrop Salah called it The Position, remember?
Has started. Well, that's what I'm thinking. That she was walking around and exacerbated like rubbing of the skin, and that gave her more potential to have either a folliculitis if it has a hair in it, or if it's just another type of, skin infection, boil or carbuncle. But if it's the hair in it, then that's the folliculitis. That's what happens with that one.
You have one too, Blumpy?
Fungal infection. Oh my God.
Yeah, I'll probably go tonight then. Hi, Tracy. I didn't go get my boil lance yet.
How could she live like this? It's beyond comprehension, Jennifer. how she turns this into content and then I turn it into content is even more of a bizarre parallel universe.
Go to the hospital? Oh my god, I'm so scared.
Scared of the money. Scared
I'm
of
trying
getting
to
caught
change the
and away.
subject. We have some concerned beasters. No, I won't pop it myself.
See, I mean, the thing is that folliculitis can turn to sepsis. So it's, people are like, oh, just didn't grow hair, let it go. Well, sometimes you actually probably should have somebody take a look at it because it could be dangerous. It's not saying just to let go. And the way she's describing it, though, she's the way she says it needs to be lanced, this, that, and the other makes me think obviously more to a boil. Because obviously with the folliculitis, you're not looking to get lanced like that. You'll have different types of treatments.
Yeah, Anna. Oh, sorry to hear that, Black Panther. I'm not taking it lightly. I just don't want to. I really don't want to go. I know, Karen, right?
Well, not going, is that not taking it lightly? Do you not see the contradiction there, Foodie? It's either just deep denial or just deeply not wanting to spend the money or just deeply lazy. I mean, there could be a combination of all of those. But I mean, if you were highly concerned, you would take yourself to a physician, wouldn't you?
It's like hard.
Yes, they certainly can.
The
They
area
get
around
real
it.
scary
It's
areas.
like a bump
They
like
get
this,
horrific.
elevated. It's like mostly purple, and then around it is like red but hard.
That does not sound good. If that's true, that doesn't sound good. Purple and red and hard, that sounds really like bad. Like that makes me think about compromised blood flow. Mm.
Don't want descriptions.
I mean, she managed to
Sorry.
survive the cat
Yeah, it's just over
scratch,
there.
so who knows?
I have a cream. I've been putting the lidocaine cream. It helps for like 5 minutes. Carbuncle bees.
Why are you putting
That's the
lidocaine
antibiotic.
cream on it? This doesn't make. I mean, I just don't think the lidocaine is the right product to ease the pain on that. I don't. I just doesn't. No. I know. I don't know why, but it's not the lidocaine. That's like more for like muscular pains or like back pain or something. Got to be very cautious with lidocaine.
Maybe I can ask if they can just put me on antibiotics first. Yeah. The problem is if they don't lance it, it's going to be so painful. But it's going to be painful when they lance it, and then it's going to start to feel better.
You're going to have to go on antibiotics either way, Chantel, probably, to be on the safe side, if it's the way you're describing it. Because they have bacterial infections generally. So in order to take care of a bacterial infection, generally an antibiotic is the best way to manage that. Oh, why don't you? Well, we know you're not going to manage your diabetes.
Hero, why do you care? You bit me. You almost caused me to have rabies. Hydrophobia.
I know lidocaine makes
no
no sense.
I think because
compress
sides, I don't know. Like, the side of your underwear. Like,
I wouldn't compress it because you could accidentally burst it,
right
and you don't want to do that.
Go on the side. Yeah, they ain't touching me if they don't. And sometimes they go, okay, let me just examine, and they squeeze it. Morphine. I wonder if they have morphine here. I hope so. So I don't know. Salah said they gave him IV drugs when he had a surgery, so maybe they do. But this is.
Why do you need to have a controlled narcotic for every one of these people? Always needs to have a controlled narcotic for things that do not require. They can give you a simple analgesic like a Tylenol, girl. You'll be fine.
Just a small thing. Yeah, some people are just prone to it. Oh, really, Bear? Yeah, cellulitis. Maybe that's what it is around it. Straight to the operating room.
What?
I'm gonna ask. I'm gonna look like I want drugs if I ask.
Yes.
Hey, Ravishing.
Yes. Yes, that's about the best thing, the most insightful thing you've said all night, Chantel. Yes, that's exactly it. It really does.
Wouldn't want drugs for an operation. It's the only good part.
It's not an operation. It's a simple procedural intervention. There's no surgery happening here. Unless you're having your leg amputated, Chantel, or the fupa amputated, which I know you would like. But there's no surgery. I think you're very, you know better, Chantel. You used to actually receive medical care in a reasonable way when you lived in Canada. But the last few years, you've just been in the wild west of Kuwait because you don't want to spend the money. And you know you can't really seek medical care because you're on a tourist visa. So you got all this just shenanigans going on. Jesus Christ, girl.
Your under boobs are always getting zits.
You're
and blends.
wild.
Oh, no. Because it's an area where there's a lot of sweat.
Yeah.
Oh, yeah, bear may spread.
Well, she'll need to get the antibiotics and probably on surgery for an extended period of time.
If I sit
Well, I mean, just that would just be for the, obviously for this particular issue. That's not addressing all of Chantel's multiple issues, of which the probably deepest one that needs to be addressed is her mental health. And then she could probably then address everything else. But I have a deep suspicion that Chantel will never properly address any of these things.
My tattoos weren't painful. I don't know why. Susan Boyle has to go.
Methadone.
Anyone who works out in the heat a lot has gotten about, yeah.
She was just taking the methadone. Whoa. No, that's a pretty decent pain reliever. Like strong.
Really, Eric?
Methadone.
Have him hold your hand. He's not allowed in the women's area. Yeah, it might be MRSA. Cherry trees. Are you going to make a cherry pie?
Well, Chantel, MRSA's nothing to laugh about because that's very hard to clear up. Okay? Absolutely would just not clear up on its own if it's MRSA. You would have to absolutely be on an antibiotic. If you are not able to get good control of that and they try certain antibiotics, you know, you could get to the worst antibiotic of all, which is vancomycin, which is just going to give you another round of C. diff, girl. So, I mean, it's just not funny. MRSA is highly contagious too. So you just be spreading it around as well. So, I mean, again, the lack of insight is just astounding. As I just Chantel, Jesus, stop it. The smoking is driving me crazy too.
I don't know, Andre Marie, they should. Yeah, I'll probably go. Hey, Mr. Johnny Cash.
Oh no, methadone can be for all sorts of different types of pain management. Not just heroin addiction.
A boil pandemic. I guess something positive. Hey, Maxine. How you doing, Mom?
Oh yeah, no good health practices.
I don't want.
Chantel doesn't need to be on antibiotics. She probably doesn't know how to finish a course.
Well, I don't know for sure, Tracy, but
see, that's the problem is you don't really want to give people like Chantel antibiotics. Well, you have to, but as a practitioner, I personally, if I knowing Chantel's history, would be very cautious because her likelihood of finishing them out is probably not great. The minute she feels good, she probably stops taking the drugs because she's just lazy like that, not realizing she increases her risk of having something like MRSA. And it's just, and then, you know, because unfortunately, it's these types of folk who are so reckless with their health are the ones that we need to give things to, like antibiotics to, because they've got stuff going on. And they are probably the least likely to finish them off, which is why we're getting all of these antibiotic resistant bacterias now. Because of, you know, and so I just have a, you know, this woman's hopeless with her health. Hopeless, in my opinion.
Yes, Bear. I'll make the drive.
Where the $2 glasses.
Yeah. I thought it
He
would
does
drop like
love
it did
those
before, but it's
$2
not, so I have to
glasses.
go.
You sure Canada doesn't want her to come back?
Yeah.
Well, they're going to have to take her back.
Do you think I have to shave, or are they going to make me shave? Or they can do it anyways?
I like Canada, and I'm sorry I have to send them back Chantel.
I don't know boiled Korean, but we will unblock you.
I know they don't want
Okay,
her back,
anyways.
except for their taxes. They want their
Yes,
tax
they
money
won't.
back.
No, because it's like not in an area where I can show.
Thank you.
The nurses will do it.
No.
Take baths frequently. I wish I had a saltwater hot tub.
No, the nurses don't want to do that. Do not give that to the nurses. And don't go putting your potential MRSA into that pool. Oh.
It would probably pop that way.
Oh.
Oh my gosh.
Yes, she needs to be in a hospital with IV antibiotics. Yeah.
Thank you, Dragon.
But supposedly it pops. She's so great now.
No, I don't.
That's the health
Korean. It might have
update.
been me by accident. I don't know.
Now, somewhere in here, she
I know,
talks
Justine. I'm just like, I
about.
hope it's a woman. I'm gonna ask for a woman. But it's the middle of the night and it's a weekend. That's why I wanted to go in the morning in case there's more women.
Gosh, no woman wants to be in deep on that, Chantel. All right, I did somewhere along in here. Foodie starts talking about insulin. So let me hold on real quick. Just because he starts talking, here it is. At this point, okay. All right, we're gonna speed along to this point where she starts talking about her insulin.
And my metformin, my blood sugars are still not low as I'd like. But maybe it's because I am eating too much crap.
Oh, really, Chantel? Go riddle me that one. Is Chantel suddenly making a correlation between food intake and diabetes? Or blood sugars? Heaven forbid. After all this time. She is about the least educated diabetic. I am guessing she did not make it to those diabetes classes that she was going to go to in the nutrition classes. This is my favorite part of this live stream because it just shows us how little Chantel understands about her type 2 diabetes. Keep going, Chantel.
So that would mean no food at all that raises your blood sugar. Okay, so I have a question. Let's say you eat chicken breast and some cheese and some veggies. That doesn't raise your blood sugar at all? Or does every time you eat, your blood you need insulin to digest it no matter what? Or is it just sugar?
What Chantel, do you know what insulin does? Does Chantel understand what insulin does? At this point, I'm thinking she does not know what insulin does. Let her continue and see if she works it out. And maybe we'll explain. It's ridiculous.
Like green veggies. I was in the hospital on IV antibiotics for over a week with one of those in my stomach. Oh my gosh, Tracy, did it heal?
Certain veggies don't have any they're not with any carbs. But some do. So it depends on whether they are a carb vegetable or not, Chantel. Certain vegetables have no carbs, and therefore they do not contain something that's going to turn into blood sugar, like a carbohydrate. And therefore you can eat lots of those veggies without even worrying about spiking your blood sugars at all. Isn't that fun? You know that thing called insulin? Well, that's really important because without insulin, Chantel, your body is unable to open up your cells of your body and be able to bring the blood sugars into your cells in order for it to do its job. You need insulin to open up your blood cells to get the blood sugars into your cells in order for them to create the energy to go work your muscles or wherever they're working, whichever part of your body the cells are in. You need that blood sugar to do that. And the insulin is the key to let that blood sugar into your cells. If you don't have enough insulin, then you're not having enough keys to open up your cells to allow that blood sugar in order to do its job. And therefore, with diabetics, as your pancreas begins to not work correctly, it doesn't produce enough insulin anymore because you've been flooding it with blood sugar. It's just going insane trying to keep up with it. Literally kind of shuts the factory down. Then you got all that blood sugar just rolling around into your bloodstream without being able to actually go into your blood, into any of your cells to actually do any of the functions because you don't have enough insulin to open it up. So if you're eating food that is creating blood sugars, whether through carbohydrates or it's because it's directly with sugar, fructose, however, probably not fructose, but less juice for you, then obviously you're going to need insulin. Does she not understand? No, she doesn't. Jesus Christ.
Carbs and sugar.
She really doesn't understand.
No matter what.
Yeah, avoid the starchy vegetables. Exactly. Shards of glass. Yes, I've talked about the shards of glass for a long time. I talked about the shards of glass to my patients for over a decade, about it being like fiberglass too. It would like literally, cut your veins up. It just rolls around, just slicing, and that's where you get the neuropathy and dicing up in your veins and stuff. And that's where your blood flow gets all messed up. It's a nasty, very, very insidious disease. And this woman doesn't even understand what insulin does. She takes insulin and she doesn't understand. The only thing that she understands is insulin is that it helps to manage her binge eating blood sugars. That's it. She's no comprehension as to why her body is shutting down, why it's not producing insulin, what insulin does, what happens if you're not producing insulin, what happens with all those excessive blood sugars, what about metabolic syndrome. She is absolutely clueless, and she sits here talking to people about health stuff all the time. Thank God her audience is shrinking. But the people and like acting like her comment section is like literally her physician's office.
So depressed.
Worst.
Carbs and sugar.
Hubcaps full of rice. Absolutely.
Disgusting.
She was into fasting back in the day. So
all the yummy stuff. Yep.
She definitely learned about insulin.
Dime size methadone. Oh my god.
Well, she doesn't seem to understand. Well,
I'm gonna go soon.
She doesn't seem to have retained that information, Sandra. Unless she just plays dumb, but I always really think she really doesn't comprehend certain things. Maybe she's been told all these things, but whether she's really comprehending, there's little evidence that she does. It's negligent. It's terrible. Too? So sad. Oh yeah, she looks terrible. I mean, this is the worst. I know she looks absolutely dreadful. She looks dreadful.
High fat is not good either. So lean, protein, and veggies. Like I always give
you give her too much credit.
Education class.
Well, that too.
Yeah, but remember that one doctor said I could eat rice? It's not true. He doesn't know what he's talking about, the one. Because I do eat rice.
Yeah. Well, you're not supposed to, Chantel, because it really does spike your glycemic index up. It's very starchy. So they really, with an unmanaged, uncontrolled diabetic, rice is your devil. Jeez, girl, you just don't understand. Gosh. A year-long water fasting. Oh, yeah, she'll be cycling through some wild diet. He takes insulin. So that's pretty much it.
I'm sure Salah doesn't want to be carting his grandma around.
He can only do
a mild spike. Oh, my gosh. So, exactly like I said.
And I think she's only on one type of basal or insulin, too. She's not even on a short acting. So she's not even on the insulin that would be the type to hit for those spikes of blood sugar. It's multiple types of insulin. And I believe that she's on a basal or long acting. And that's not going to do anything for binge eating stuff at all. They were trying to give her like a control, like a base control. And she's like, using it like a short acting Humalog or something. And I think it's an MPH. She's no idea. So dangerous. I mean, we had to spend a lot of time learning about how to administer insulin to patients because it is such a highly dangerous medication, not to be played with. But Chantel, luckily, her blood sugars just live so high. I don't think she could actually tank her blood sugars down low enough with these drugs.
Say water fast. Eat the chicken.
Dietary question. Type 2 diabetic here. Southeast Asian. I need rice to live. I tried to stop rice.
Yeah, you should feel guilty eating donuts.
What are your options? Oh,
very small portion of rice. Yeah. Yeah, I will, Mike.
That's a good question. I would suggest. I guess the thing to do is to try to maybe. Aren't there other types of noodles that maybe don't have as much like sugars to them? I want to say like soba noodles or maybe slightly better. Like, I mean, they're all still going to have the carbs to them. But I usually try to say go towards the vegetables more to get away from the rice. And that's interesting about the withdrawal symptoms. I wonder what that potentially could be from. That's interesting. I'd have to research that. That would be a research for me.
Give me 10 minutes.
Rice, broccoli. Yeah, I was about to say maybe a vegetable.
I'd have to go back to Canada.
Like a rice cauliflower, a rice broccoli, something of a vegetable type. I want to say maybe soba noodles are made a little differently and maybe they don't have the same glycemic spike because, all of these noodles, they're all going to have, or using some type of noodle that comes from a vegetable.
Too expensive here.
I guess it was from the sugar not being there.
Realistic plan.
Yes, maybe even like the egg noodles. Noodles made with eggs. But I know you don't want to do a lot of that stuff. That's a good question. I'd have to research that.
Maybe we should go to Canada sooner than later. Hey, Gabrielle.
I think that's why they try to say you can have just a small amount. So maybe just take the smallest amount possible. Like a quarter of a cup a day. It's a very small amount just to kind of have that little bit of satisfaction without a massive glycemic spike and just making sure that you count that as a carb count.
My health,
would be a recommendation too, I would say.
Yeah, Kit Kat. I have to bring the cat.
Yeah, I would try to just say not to like cold turkey it. That sounds like you went cold turkey off the rice.
Instantly, Carb count.
She's on the max dose of
metformin.
Yeah, they can't do it anymore.
The hospital is not far
There's
enough.
other complications with metformin too. I mean, I want to say I went into all of these complications about the metformin and other things. And, the metformin is, trying to eat the blood sugars up that are remaining. And then the insulin is trying to, do the role it's supposed to do to let blood sugars into her cells because she's probably wrecked her pancreas.
Doctors. True.
Oh, my goodness, God.
Yeah.
The kidneys. Yes, exactly. The kidneys. Very hard on the kidneys.
No water fast.
And You should be getting your kidneys checked. And Chantel probably not checking her kidneys. That's right. It's hard on the kidneys. The kidneys, exactly. It does seem not be able to eat any carbs. It does. That's very hard. That is hard.
It's a lot of Julia to Canada.
She hates the metformin. She's keeping her alive though. All right, Chantel.
More risky. Diabetic dietitian info. Okay, Scrange. I know I've been over this a million times, but I look cozy. I'm actually not sleepy, but I'm nervous.
All right, Chantel, we're gonna get over to your health update at this point.
Stop seeing my therapist, but I can just.
I think we've all caught the gist there, Chantel. All right, so let's get. She had a health update, and this is quick, and we'll finish it out here, guys, because that was getting very long, and she's just gonna keep saying the same things over and over again, as we know. All right, Chantel, let me get over here. All right, so this is her most recent health update. She's not getting her A1Cs checked or any other panels done. Oh, she doesn't know her A1C. I know she's doing her blood sugars, but she doesn't. Her A1C is dreadful. It's probably off the charts. I mean, just probably. All right, let's put her to 1.25. She might speak a little faster in this one. We'll see. It's luckily it's not too much, so we'll get this finished up because it's been a long night and I've already kept you guys too much. All right, keep going, Chantel. I gotta go to work in the morning. I gotta be up early.
Hello, Foodie Beauty.
Dog wants to walk.
Hey there, Beezers. I want a personalized video from me to you that you can keep forever, or maybe a special shout out.
Oh, finally, Chantel. She does a morning.
Hi guys, hello guys. How are you? I'm here to provide you with a health update of sorts. I know you've been waiting for that.
Why? Why when she does these does she put pictures of the cat and stuff? Is this just Julia's precious? We love you, Julia. Free Julia. Poor Julia. Health update. Oh, A1C is the A1C is your hemoglobin A1C. So what they'll do is they'll take your blood and they will get what's known as a hemoglobin A1C, and it will give an idea of what your blood sugars have been doing in a 3-month period. So it's not something that you can fast and hope to cheat on the test to get a better result so that you can say to yourself, I'm not a diabetic. And it will give you an overall picture of what your blood sugars have been doing over a 3-month period. And so most diabetics, that's what they'll, you can't cheat that test. So you don't have to fast for it. And it's one of the primary tests for diagnosing somebody with type 2 diabetes. All right, take it away.
Sorry for the delay. I've just been sleeping a lot, actually, and which I usually do if I'm healing from something. Anything from a cold, a flu, to this.
Chantel, I mean, yes, but you sleep a lot. You're healing from a lot all the time.
Whatever it is, abscess, boil, whatever you want to call it. So what happened basically yesterday?
It was either a boil or a carbuncle. I don't know about an abscess. That would be like in your teeth or something.
After my live stream, I'm going to call it an abscess. It had gotten to the point where it was like very painful because of the pressure that was behind it. It was quite large and there was a lot of fluid buildup. And
well, that sounds like a boil or a carbuncle. So all that fluid, girl. That's what we just saw in that comprehensive overview. You can call it an abscess all you want, but that's not what that is.
Yeah, by the way, if you're grossed out by things like this, just a warning, you might not want to listen to this because it's pretty gross. So.
But Chantel had to monetize it, of course. And since I'm a medical professional, I'm going to have the displeasure with all of you to listen to this lovely tale from Chantel.
Basically, And I'm not on camera because I don't feel like getting all ready and everything. I'm just like, yeah, on my bed.
Thank you.
Just
Yes,
yeah,
education.
draining and everything. So anyways, yeah, I know, nasty. So basically, after I got off live, I said I was
Right,
going to go to the
exactly.
hospital because it wasn't draining on its own and it was very painful and, you know, could become infected. So, but almost like
It
not long
could
after I got
become
off live, like I
infected.
had a shower, like a
It could become infected. Chantel, having that already says you're infected. It's not could be infected. It is an infection. This is your skin screaming at you. This is a skin infection. This is a skin infection. I don't know how hard, purple, hard, painful, and pussy it needs to be for you to say, oh, that's a skin infection.
warm shower and to get like ER fresh, you know, it popped. I don't know if it was like the warm water.
No, Chantel, it was the warm water, and then you probably poked at it while it was under there. I think you wanted it to pop. If that's the case, that's nasty.
Or what,
Gives
but
me the
like,
shudders.
because I did have a shower earlier that day. You know, I took more frequent showers in the hot water in hopes that that would like weaken the skin barrier and it would pop on its own. Just
One, I think she's scared of being kicked out of the country, and two, she's cheap. She wouldn't want to spend the money. She doesn't barely want to spend the money on this poor cat. The only thing she likes to spend money on is food. That's it. She barely, you know, she's even cheap on her clothes and stuff. The only thing she spends money really on is food and probably the apartment.
to get some relief, you know, from the pressure buildup. But yeah, it did pop.
Oh,
it was
it's
just
cheap.
like, okay,
It's
like
cheap.
now's the time.
Yeah, it's already
And
infected. Yeah.
this is going to be so disgusting. Just like all of this purple, there was no white, it was just like purple, reddish purple fluid that just poured out of it.
That sounds like it has blood in it, Chantel. That's highly infected. If it's got like different colors in the serous fluid. Oh. This is why I do psychiatric nursing. Don't want to deal with this anymore. I've dealt with enough skin wounds and nasty nut. Ugh. Because the skin is the largest organ of the body. And Chantel, if your skin is getting lesions and boils and carbuncles and all of these different things, it's a pretty good barometer that you are not healthy. The skin is the largest organ of the body. Looking at the skin is a very good idea of somebody's overall health. It really is. It's a good picture. And your picture doesn't sound like it's coming in very good.
It was like, it was disgusting. It was a lot of fluid. And
Oh,
it was disgusting. Like the smell is like as if turnips were rotting and festering in the sun for like a week straight. It's disgusting. I can't describe it.
how are you smelling it if you were supposedly in the shower and it was being rinsed away? I mean, it would have kind of lessened the smell. So was it that bad? You could smell it that strongly in the shower too? Well, if there's an odor involved, that already says that's really infected. Because that's the bacteria that's creating all of that. I don't even know what to say. That's not a good sign. And you're talking about this stuff. Thank God we're looking at Julia. I guess this is the palate cleanser.
It's like a pungent, purulent, very decaying, gross, disgusting smell. So I stayed in the
Oh,
shower
thank
and
you,
just let it drain a
Tammy.
bit. Then when I got out, I didn't
She
have
is
anything,
full of it.
so I put some paper towel, and that got soaked up pretty quick. Like I added a lot, and it still got soaked up. So I didn't go to the hospital that night because I'm not going to go into the hospital.
Because why try to get an antibiotic or have anybody actually take a look and see what that wound would look like? You know, why? Because I don't care if I get a sepsis. It's nothing gonna happen now because it's popped. I don't think that's the case, Chantel. Not in reality. It would need to be seen because if you're a diabetic and you just had that and all that smell and supposed purulent pus coming out with an odor, then you definitely needed to get seen by somebody because you need to be on an antibiotic to probably curtail whatever's going on because diabetics don't heal well either. So this is not like something that's going to be resolved in a couple of days. That thing's going to take time to heal on your skin. Ugh.
Smelling like that and everything like grossed me out. So
Yeah.
I would rather honestly die. Not literally, but
Right.
you know what I mean. Like it was just I'm not
I
going to
know.
go when it's still draining. So in the morning,
I mean, diabetics do get these things. I mean, so it's hard to know with Chantel, you know, how much is content and how much is truth. And because as a diabetic and somebody as unmanaged as Chantel, she is definitely going to be getting these things. She is definitely going to be getting these things. And she has no content. So she's potentially could talk about just terrible stuff like this. It's just it's funny because she's such a liar. It's hard to believe her. And you know, because she has such a history of it. But on the other hand, knowing her history of her illnesses and just looking at her physically, it makes sense that she could get these and something. And it makes sense that she wouldn't go see a doctor to have it properly cared for and that she would tell people that. That makes sense too.
Salah took me to the clinic, not the hospital, and they, looked at it. They cleaned it up better. We got a bunch of sterile bandages, just like huge pieces of sterile gauze. And then when it's draining less, like you just pack it with the gauze, not pack the wound inside because it's actually there's not like a hole.
Right.
So it's just, yeah, it's like,
no way. Yeah, she's lying about seeing any type of doctor. Maybe Salah went to a pharmacy and got some gauze or something for her. And is it a wet to dry? Do you know what way to pack that type of wound, Chantel? Probably sounds like you need to get some gauze and some Dakins and do a wet to dry. Because you don't want gauze like sticking into a pussy skin thing like that. That's going to be painful to pull that dry gauze out, girl. You don't pack like that. She knows nothing about wound care.
how do I explain it? There's no hole. So like they don't have to pack it. And
No hole.
this
No
abscess
hole.
in this area has never had to be packed. So like that. I did have some abscesses before.
Still probably want to do a wet to dry.
Or that needed to be packed, but this one no. So anyway,
that's terrible.
Basically, I'm on some oral antibiotics, and I just have to, keep it very clean with soap and water. Then, use the dressings.
Pardon my for yawning. If she really is on oral antibiotics, and she did get, I would be happy for her to be on antibiotics and to finish the course. So hopefully she's not lying about this part because she does need that. I mean, Chantel, if you are lying, please go get yourself properly checked out.
And yeah, it's, that's about it. And then take the antibiotics. And if I feel bad and I have a fever or anything like that, you know how they tell you, return to the hospital, maybe I'll need something else. I don't know. So yeah,
I almost would think potentially she had this boil carbuncle, it popped, and in the shower, and she just let it go from there. Potentially the part about salon, the gauze, and her getting the oral antibiotics, that could be bullshit.
I guess that's pretty much it. Like, I don't really have much else to say. Like, I have pretty much, it was like when it popped, it was almost like instant relief. It was just, I feel a lot better in terms of that, but the area is still pretty sore.
That's not necessarily, I mean, I'm sure, because if it was as bad as you described, Chantel, I'm sure that purulent pus in there was causing a great deal of pain inside of that space. I'm sure it was not happy, and the redness, all of that. And so probably taking the pressure and all of that probably did feel better. But unless you're really properly going to care for this, oh God. Is her body just full of festering wounds? I don't want to think about it.
As it's going to heal, of course it's going to be a bit sore, but
Even a photo of the hospital.
so, and the nurses actually said that, like, these are not uncommon in Kuwait because of how hot it is. And
Chantel, it's not uncommon if you're a diabetic either. Okay, they may have been trying to make you feel better if you were there, supposedly, about, people having it through the heat. I'm just laughing and shaking my head because obviously it's a level of denial and delusion to somebody who doesn't want to face facts. Like, I've trashed my health. I don't take care of myself properly. I don't even know what insulin does for the body. I don't follow up with anybody. I tell everybody I'm going to go on all these variety of health journeys, fast, whatever. It's the same nonsense at all times. I really don't know how to really manage anything. Oh Lord,
that can happen. Like, I don't know. It's not really that hot here, so for me, I don't think this was the case. I think my diabetes might just be a complication of my diabetes as well. And
as well, no, it is a complication of your diabetes. The hot weather could help exacerbate what is a complication of diabetes and make it more potentially prevalent. But the major thing is that you're diabetic and you're going to get this skin stuff.
Also, just, maybe, I don't know, friction from what I wear sometimes. It could be like from shaving, they said. It could be like, but typically, people with diabetes, they do get these abscesses, unfortunately, but more easily. So yeah, I'm just letting it drain out, so it's still draining. Like, I have to change these. I'm taking like 2 showers.
And just Jamie, how do you have no hole, but it's draining? That doesn't make sense. It's flat but draining. That makes 0 sense, Chantel. I guess this is not a golf ball size thing that needs to be packed. Gosh, girl, if you've had to have things packed like that before, having to pack a wound is pretty intense. It usually means it's, fairly deep in the fascia. Oh, Chantel, you're 41.
I'm going to be taking 2 showers a day, but I already took one. I'm about to go take another shower, put fresh gauze. It's the only way I don't feel icky. And,
Nobody believes that you're taking 2 showers a day, Chantel. Nobody believes you take 2 showers in a week. Just don't ever appear to be a clean person.
Oh, I'm just pretty, don't have really good energy. As for my blood sugars, my blood sugars were higher when I had the abscess. So right after it burst and I had a shower
No.
and everything. I laid down and I took my blood sugar.
No. Chantel, are you seriously trying to say that bursting a boil decreased, like you lost blood sugar from the release of that pus, and magically your blood sugars dropped with it? The level of just delusion and lack of understanding. You cannot, Chantel, if you really have this type of comprehension around your diabetes, I seriously urge you, take some stuff online. I'm sure like the Canadian government probably even provides online training. I know the National Institutes of Health does. For God's sake, educate yourself with something about this disease. Please stop coming out here and just sounding like just very uneducated around a health topic that is affecting your life enormously. That's the nice way to put it.
Sugar reading, and this was like on fasting, and it was like 16.5 mmol.
Yes,
And which I don't know with the other conversion it is, but it's easy to Google anyway if you're really that interested. But 16 is high. Like a normal person without diabetes would have
16. Is that your 16 on your Canadian thing? 16? Oh my God, girl, that's something I gotta convert for our American audience. Mole to deciliters. Here we go. She said she was 16. Oh my goodness. Let me see. Oh, she said she was 16. Calculate. That was the 288 blood sugar. That's outrageous, Chantel. 288? Girl, that's almost 3 times what you should be. And that's you on meds? Is that you low? After it burst? God, I hope that was your low one. They're talking about the blood sugar that lowered because the boil burst. That has got to be the wildest thing I think I've ever heard. I've heard some wild things being said by patients. I would even know if somebody said that to me on the floor. I don't even know what face I would make. I mean, I don't expect to have everyone be super educated and knowledgeable. But if it's a disease that's been affected you, as much as this one's been affecting Chantel, and as much as she's supposedly coming on YouTube, girl, could you not just do a modicum of reading around the topic? I probably do more reading about your health stuff, and I already know a lot, but I always read a little bit more before I come onto these lives. I always do a little bit more educating of myself. And it's just astounding that I spend more time and effort probably than you do. And it's your body, girl, not mine.
maybe a reading of 5 when fasting. So
one has been
yeah, it's more than triple. It was bad.
So,
and so I was like, oh no, but my blood sugar tends to be higher when I'm fighting some kind of infection. Like whenever I had that kidney infection, and I was in the hospital, my blood sugars were like 24, 25, and they were like not letting me out of the hospital.
Well, that's because you were having all sorts of things going wrong with your body. And sometimes when you're sick and you don't feel good, guess what? Your blood sugars become elevated too. Shocking.
Until they went down. So they had to give me like a series of insulin. I haven't had my insulin today yet. I usually take that in the evening, but I'm actually super happy that I did. I took
Yeah, I think you are supposed to take that insulin at night, Chantel. You're supposed to take it like before you go to bed so it can do your like basilar like coverage and then go throughout the day. It's not short acting. It's not the ones that you take prior to a meal in order to, keep your blood sugars in check. It's not a Humalog. You're not on short acting. I don't think they'd even you don't have a regular endocrinologist. So there isn't somebody to prescribe you that medication.
So basically, I had to eat. I was like,
Dangerous for
I don't
people
know,
like
like
you.
I'm like really hungry, like more than usual, but not for like junk. Like the thought of junk, like when I'm sick, it just makes me feel sick, obviously, because your body's telling you like,
But I mean, even though Chantel's wrecked her circadian cycle, technically, yes, she should still take it at night. Even though Chantel's cycle is not quite the way it should be, still technically for how your body works at night, it does different things. In why people that work night shift and stuff have elevated blood sugars. So her staying up all night is actually not helping her blood sugar either.
give me nutrients to help heal. So I had some like lentil soup and
Right.
some mahashi,
Oh,
which is
I know
stuffed vegetables with
know.
rice. And I know rice, but I was just like, that's what I was feeling, like I'm like, I need mahashi, I need stuffed.
Yeah, I need because your diabetes, your blood sugars are raging your body. So you just can't get out of that cycle because your body is also, craving certain things because it's used to it. Ay, Chantel.
Vegetables. So I ate a plate of that and some lentil soup, and then I took my metformin and I had a nap. I woke up.
I mean, the lentils are a lot of carbs.
A few hours later, and I checked my blood sugar, and it was 11 mmol. So that's like 5 points down, which
11 is, let me see. Reset. Sorry, I'm trying to calculate 11 here. Calculate. That's 198. So that's still double what you should be, Chantel. And this is somebody who takes medications, and this is what I mean. She has no control. This is really bad. Everything on the guidelines for diabetes, none of this is good. And she should be on like a lot of meds. I mean, this is bad, but she makes no lifestyle changes. None of these medications, and I've said this always, unless she makes lifestyle changes and dietary changes, these meds are pointless almost. They're barely keeping this. That's why they're not doing anything barely. I mean, yeah, she'd be 400 otherwise. But this is girl.
Which is really, that helps, So
I guess it's interesting because I was just, like I said, about a week ago, I was at a conference listening to a doctor who does the weight loss clinic from Duke. And we were talking about, obviously, these different topics around weight. I don't even know how Chantel would fall into that spectrum because she's so non-compliant with everything. I don't think she would ever get to the point. We were, they were talking about that and bariatrics. So a lot of interesting topics, but I don't think Chantel would be a candidate for any of it.
Yeah, that's still elevated, obviously, but when you're diabetic, you're not going to have normal blood sugar levels.
I know.
But they should be lower than that. Like,
yeah, that's a lot of carbs. Too many carbs.
Excuse me. Yeah, that's what I had. That's what I did.
She doesn't care about the life she was given.
So now I'm like so
you're
hungry again,
Mediterranean.
and after my nap, and I'm going to have some. Basically, I ordered half of a grilled chicken, like just a half of a rotisserie chicken, and it has like no sauce or anything on it. And
now we're into, Chantel is suddenly on her, her health food journey or whatever, food health journey or whatever, because she had a boil in her area. But we're looking at a picture of Julia, so how much can we believe of Chantel just eating some, half a roasted chicken? Just eating for a family of 4, but making smart choices.
And a fattoush salad,
Fattoush salad,
which is just dressed with all.
No, fattoush salad is the devil for you, girl. That thing is drowning in oils, and you know it, and bread and all sorts of crud in there, girl. Fattoush salad, girl. You make
olive oil and lemon juice. So yeah, that's basically what I'm having. I'm trying really hard to not eat sugars,
the exotic chicken.
especially like added sugars and stuff like that.
Oh.
I would
So you
say
were gonna
like
have
low
the
carb, but I did
Mediterranean
have
diet.
like stuffed rice stuffed vegetables, but I don't know, it just you know, I'm trying to just not eat as much. Like they don't stuff the vegetables
Oh, I'm just trying not to eat as much.
with like a ton of rice. So
I have nothing to say.
maybe that's why, I don't know. But yeah, I'm
The
just really
willpower.
trying to watch it now, pretty much. So I don't know. Eventually, when I feel a bit better, I'll.
Yes, Chantel, we know we support you. We know you are working hard on your diet. You're watching what you eat because you know you were taught that lesson when you got the boil in your vajayjay. You learned nothing, Chantel. And unless we see a bottle with a date and the antibiotic prescription, I will not believe you. And written in Arabic.
You know, put together a better meal plan and stuff like that, and try to stick to it because.
Yeah, too many cards at the fattoush. Yeah,
I'm just so over feeling like crap. Now, I always say this every time I get sick.
Yes, you do, Chantel. Yes, you do. That's the moment of clarity and insight that you will have. But unfortunately, that will be it because you will continue the same cycle and the same patterns because you have no others to fall back on. You have no healthy coping mechanisms. You have no interventions of support. You are just freewheeling it out there. And this is what you get. The same cycle over and over and over. And eating a fattoush salad and all of these things, none of these things are good choices. People like you literally have to be put on a liquid diet and starved down. That's it. And that would be impossible for someone like you. And you would not even want to take the pain to make the gain as far as your health and your body. So I think you're just going to continue in this perpetual cycle. That's my thought at this time.
And then eventually I just forget that I was sick and go back to my old ways.
Exactly.
I don't know what to say about that. All I can say is
cootie boils.
Addiction is rubbish. And
I know.
But regardless, I have to find the strength in me, you know.
I know, cootie boils.
So,
I like that.
Anyways, that's another story for another time, another topic. So yeah, that's about it. I just wanted to let you guys know because I know a lot of you were worried about me.
Yes, we were all with bated breath and you know, biting our nails because we were so worried and stressed about you, Chantel, with that boil. Whether it was going to go septic on you.
You know, knock on wood, but I'm on the mend, hopefully. And yeah, just feeling a bit tired. So
no, Chantel. I mean, on the mend, I guess, but you're not on the mend. Your health issues are going to continue to carry on. They're just going to happen because you don't really tackle anything. You are raging diabetic and uncontrolled. Still to this day, your type 2 diabetes is still unmanaged. And you still give out the worst information and you still don't know what insulin does. Please learn what insulin does.
Worn out, probably from the pain. But that's about it, guys. So thanks for listening. Thanks for your well wishes and everything and your concern. And I will see you guys when I'm feeling a bit better. Bye.
Oh, thank you, Chantel. Oh, thank you, Chantel. Oh, my goodness. Yes, I did not think I would spend my Sunday evening talking about Chantel's cutie boils either. Huh. Well, I'm glad that nothing's changed. You prefer Amberlynn Reed, Ross? Well, we could talk about Amberlynn Reed too, because she's coming out with all sorts of mental health diagnoses, some of which aren't even included in the DSM-5 with text revision, which is the complex post-traumatic stress disorder. Doesn't even exist. I'd be curious to know who diagnosed that, because they're not going to get paid by anybody because you can't diagnose that disorder. So I would be interested to know where she got it from. Oh my Lord, these people. I know. A 12-year-old, 12 years old. Oh my goodness. You can't stand either of them, Sandra? I know. Well, you know what, guys? Thank you guys for joining me. I have been having some fun with Sarasota Tim lately because I have an attorney doing counter notifications. And so he's all miserable at the moment. And he did a sort of motivational / crushing it for Christ today, where he talked about how what you hear in social media, you need to believe the opposite of that. So if somebody has expertise, say like myself in healthcare, and I say things about Chantel's diabetes, well, you're supposed to believe the opposite of that. That's what Tim says, because Tim has so many haters at the moment, including myself, obviously, because Tim decided to dox out my home address the other day. And he does not, I think he thinks the counter notification is it, and then he's going to move his way on. Well, no, I probably have more legal actions. Well, I know that I do, that will be sent to him that my attorneys are working on at the moment. So no rest for the wicked, Tim. There's more to come. A lot more to come. Oh, and you could just tell he's like, his mood is just awesome at the moment. He's really happy. I'm making his life so happy. Yeah, Timmy thinks he's untouchable. Absolutely. AOL has got it from the internet. Well, I usually like to get my mental health diagnoses from the internet too. You appreciated the time I took talking to you about Foodie tonight? Oh, well, I am glad to be back. I will try to come back as much as I possibly can to do Foodie. I will come back. The vibe in the Raid Chantel sphere is fun. Yes, it is. It is a fun environment. And I'm sure if I get back out more, we will add more people to the fun. I mean, I know that I have to compete with the many medical experts that exist in Girl World. And there are many. They are very good at getting on to Dr. Google and telling us all about the different things. But I mean, fair is fair. But you think I'm engaging? Well, thank you. I sorry if I yawned tonight. I've had a very busy day. And obviously I was live streaming last night too, and I obviously have a lot been going on. I'm terrific and I'm truthful. Yeah, I'm very truthful. Unfortunately, it gets me in trouble. But I did want to thank Cat Lady for becoming a member today. That was awesome. And I'm glad that I changed the chat so that I could let everybody in instead of just to members. I kept thinking it looked odd, and now I know why. And I'm glad I fixed it. But I thank all my mods, Angel of Glass and Miss Catherine, for being here this evening, and for all of you for being here tonight and joining me back for Chantel's cutie boils. Chantel, I do hope you're on an antibiotic, and I do hope you're keeping it clean, And I do hope that you're going to try to control your diabetes, because if you don't, these things are only going to get worse at the end of the day. The non-experts, there are many of them. And as Tim would say, those are the people that you should listen to. The people who know nothing are the people that are telling you the truth, or whatever he was on about today. I think I might do. I almost wanted to do a members only on that one. And I was like, you know what? I just want to go outside and play with my flowers, because I spent a bunch of money over it. Oh, yeah, this was the one thing I did get today, because of the fact that people have decided to start doxing out my home address on the internet. They had this sort of like sale at the Home Depot today. They had like a Black Friday spring sale. So I got this the ring with the indoor camera, so I can watch Junebug while I'm at work. So I got that, and then I got the little battery backup set to that. So I get to install this. Why does it sound like this? I hope it's okay. They just took it down. It's very shaky. I hope nothing broken in there. Anyway, so yeah, I gotta go set that up. So yeah, there we go. Kia ora, Hare, from New Zealand. Well, I hope I pronounced that correctly. You have one? You have one of these? Well, I hope this. Hopefully that's just the screws in there that I'm hearing rattling. I've never had one. But it doesn't match my door. I should have got that. This was the one on sale. The bronze one was more expensive. That the bronze would match my door area better. But I said I'll get this one. Hopefully it's easy to install. This is just the battery one. It's not the wireless or the one where I have to wire it in. All right. Okay. It's a great idea. Yes. If anybody decides to be weird and come to my house, I will know. And the best part is the indoor camera. That's the one I like, because I can watch Junebug while I'm at work. She doesn't do anything destructive, but it would be fun to just check in and see how she's doing. Yeah, I'll be careful. Oh, yeah, I'll be careful. Oh, yeah, because these people are getting wild. They are getting wild. And it's interesting that Tim wants to talk about other people being, the haters, and how these people are so bad, and how bad people, get theirs and so forth. I'm thinking while I'm listening to this, well, Tim, you're the bad person then. Why are you trying to assume that somebody who is trying to stop you from spreading medical misinformation around, why does that make me the bad person? I'm not somebody who's trying to scam people or try to make up content to grift people for money. If anything, my whole purpose of my platform is to stop all this, especially medical misinformation, because there is literally a war on medicine. There are so many people like Sarasota Tim's. Chantel just ignorant, I think, sometimes around issues and around health. She knows better. She chooses to not know better. She does know better, but she chooses not to do better, I should say. Whereas Tim is just one of these individuals. He just wants to demonize anybody. And it's part of that, and I'm not a political channel or anything, but it is part of an authoritarian playbook. Having people that have expertise, having that, no, those people aren't. But me, who knows nothing, no, I'm the expert. I know how my body feels. I know. And it's just when I hear that, and Chantel was saying this a little bit as well, when that's where that these people aren't well educated around topics of health. Because if anything that we learn in medicine is that the body will compensate for a very long period of time before it will actually crash. And people then really do suffer the consequences. So that stuff about, oh, I just know my body, it's BSery. And it's just today his religious motivational talk was just, it was such a wine fest from him. And it really was about, it really was aimed somewhat at me, because I'm the person making Tim's life, unhappy at the moment. And he just wants to make sure that his followers don't come to my information or somebody else and find out that Tim is lying about his cardiac stuff. Promise you, he's not going to mention anything about a stress test or an echo or anything. Listen, has not mentioned anything since he got that counter from my attorney. He's not mentioned one thing about his cardiac health. And he's been really careful about not talking about topics around health, because I've literally have called him out for that in that counter, like calling him a scammer. Anyway, all right, guys, I gotta go. I could talk forever about how Tim is annoying, but I know everyone's got to go to bed. I got to get to work in the morning, and I had a blast. So I appreciate it. It was fun to come back to Foodie. I will be doing more. I will be doing more. Oh, Marina. I did somebody. Oh my gosh. Well, I'm so sorry for anybody who lost a loved one. I'm so sorry. I know that must be hard. See, my mum and I aren't close at all, so I hate to say that, but anyway, life is difficult sometimes. It is, but we learn and we grow and we all get cool from it. This is going to be fun to put up. All right, guys, I got to take Junebug out before I go to bed. All right, take care. Bye.